Good morning. My name is James Valentine, and welcome to the externally led, patient-focused drug development meeting for xerostomia. I'm here with my co-host, Amanda Hollinger from the Head and Neck Cancer Alliance, and we are coming to you live from the Washington, D.C. metropolitan area, actually not too far from where the U.S. Food and Drug Administration headquarters are located. To open today's meeting, it is my pleasure to introduce Amanda, Executive Director of the Head and Neck Cancer Alliance, who will be providing some welcoming remarks. Amanda?
Thank you, James. Welcome to the externally led, patient-focused drug development meeting on xerostomia. I'm Amanda Hollinger, and I have the honor of serving as Executive Director of the Head and Neck Cancer Alliance. Our organization has planned this meeting in conjunction with the Thyroid Head and Neck Cancer Foundation, THANC, Support for People with Oral and Head and Neck Cancer, SPOHNC, and National Foundation for Swallowing Disorders, along with many other supporters. I am here today as the meeting co-moderator and representing all of these organizations. The voice of the person with xerostomia has always been a part of our work and has helped push our advocacy goals forward. As you will hear today, xerostomia is so much more than just dry mouth and has daily consequences for those who suffer from having it. I'd like to extend a welcome to the FDA staff who are taking the time to join us today to learn more about xerostomia. Thank you to our industry supporter, Mira GTX, who financially made it possible to host this meeting. It could not have happened without you. And finally, a heartfelt thank you to the families and caregivers who are sharing their experiences with xerostomia in the hope of finding new treatments. This meeting is for you. At the Head and Neck Cancer Alliance, we talk to patients every day who are facing a long and difficult treatment journey, followed by long-term side effects in many cases. Xerostomia is just one of many side effects facing these patients. Head and neck cancer survivors, along with others who experience chronic dry mouth caused by a variety of conditions, want effective treatments. You'll hear today about the reality of living with xerostomia from people who experience this condition. To all the people with xerostomia and their loved ones participating today, we invite you to call in or write in during this program. It is critical to the success of this meeting that we hear from as many voices as possible. The more perspectives we have, the better we can increase understanding about the impacts of living with xerostomia and ultimately find better treatments. This meeting is for you, and your stories are important. Now I'd like to welcome Dr. Kendall Marcus, the Director of Division of Dermatology and Dentistry at the FDA. Dr. Marcus will provide some opening remarks. Dr. Marcus?
Thank you, Amanda. Good morning. Welcome to the Patient-Focused Drug Development Meeting on xerostomia. I'm the Director of the Division of Dermatology and Dentistry in the Office of New Drugs at the FDA. Our division reviews drugs for the prevention and treatment of dermatologic and dental conditions, including xerostomia. This is an important meeting, and we are looking forward to hearing from patients, your loved ones, and caregivers about how they think about xerostomia and what is important about potential treatments. I'm going to spend a few minutes explaining the role of the FDA and drug companies in the development of new drugs in order that people here today understand where FDA fits into the process. FDA promotes and protects public health by regulating drug development and research done by drug companies and other researchers. Drug companies are the ones who conduct studies of new drugs for medical conditions like xerostomia. When they are finished conducting their studies, they submit marketing applications to the FDA to ask for permission to sell those drugs in the United States. It is our job to review the drug company's study plans and then to review their marketing applications to make sure that the possible benefits of a drug outweigh its possible risks. If we think the company has done a good job and shown that the drug works and described the possible side effects and that the benefit risk assessment is favorable, then we let them sell the drug in the US. This is how FDA regulates drug companies. One final point that is important to understand is that FDA cannot direct or order drug companies to develop drugs for specific medical conditions. So where do patients fit into this process? We want to hear from you today to help us understand how patients view benefits and risks of possible new treatments for xerostomia. We think very carefully about the kinds of things we should be measuring and looking at when evaluating a new drug, and hearing your perspectives on this is very important. Today's meeting is about listening to you and your loved ones about how xerostomia impacts your daily lives and what you value in a potential new treatment. Back to you, Amanda. Thank you.
Thank you, Dr. Marcus. Now to provide a clinical overview of xerostomia, we are joined by Dr. James Schuba, retired professor and consultant at Johns Hopkins School of Medicine and the Department of Otolaryngology, Head and Neck Surgery. Welcome, Dr. Schuba.
Good morning. I appreciate the opportunity to speak about xerostomia, or dry mouth, as it relates to saliva and the oral environment. The next slide, please. So what is saliva, what's in it, and why worry about it? Well, we all know what it is, but what is in it is a complex subject. Saliva is 98 to 99% water, but it's that other 1 to 2% of composition that makes it a very, very special biological fluid, and in fact, is crucial for maintaining oral homeostasis, or basically balance between bacteria and function and so forth. And so why worry about it? Well, as the old adage goes, you don't miss the water until the well is dry. And when there's absence of saliva, it creates a whole host of problems, which we will go through quickly this morning and attempt to further educate you concerning this very important biological fluid. Next slide, please. So, salivary dysfunction. Lots and lots of reasons why saliva production is impacted negatively. A big factor is medications. Many medications we use these days have a secondary role in reducing salivary flow. The important autoimmune disease Sjogren's syndrome, either primary or secondary Sjogren's syndrome, has one of the key features of dry mouth present all the time. Also dry eye and other body systems are affected. And importantly so, the role of radiation therapy in the management of oral and head and neck cancer has a direct negative impact on salivary gland flow, because the radiation that's delivered to the tumor often affects the salivary glands in the same neighborhood or same environment. And with that comes a whole host of issues, in addition to the direct involvement of soft tissue as well as salivary flow. And finally, as another of the major issues of salivary negative production is anxiety. Anxiety by itself, in the absence of medications, has a direct impact on reduced salivary flow rate. And the other factors: obstruction of salivary gland duct features, uncommon. HIV-associated salivary disease in the untreated HIV patient is common, but these days, HIV disease, when treated, has a relatively limited effect on salivary flow. It is often said that with increasing age, we have lack of salivary flow or diminished salivary flow, and that's never been proven. But what we do see in the elderly is polypharmacy. Many drugs that the elderly take for one reason or another has a direct impact on negative impact on salivary flow. The term xerogenic drugs, or drugs that produce dryness, can affect all ages, but in particular the elderly, because we take more drugs than young people do, for obvious reasons. Next slide, please. So what are the comorbid conditions? Autoimmune diseases, which I've said, chiefly Sjogren's syndrome, and external beam radiation therapy. Those are the two big ones as far as conditions are concerned. Next slide, please. So how is radiation delivered? Well, typically, conventional therapy will produce a 60 to 70% impact on salivary diminishment or dysfunction. More recently, a technique known as IMRT, modulated radiotherapy, or intensity modulated radiotherapy, tends to target the tumor much more specifically, with less damage to the surrounding normal tissue adjacent to a tumor. And that's been a major positive increase in tumor control, and a corresponding diminution of collateral damage, including salivary gland collateral damage. Next slide, please. This work was done by Sam Dreisen many years ago in Texas. This was more conventional radiotherapy, not the kind of therapy we are using today. However, it does show in a very rapid time frame the rapid fall off in salivary flow by the middle of the first week or so. You begin to see a very, very sharp drop off. Now, this curve has been extended out by more conventional modern technologies, but nevertheless, you cannot separate this level of salivary dysfunction from what we're doing today in terms of cancer management. Next slide, please. So, how much saliva is produced by the parotid glands, which are those glands on the side of our face? Approximately 50% of our daily salivary flow comes from the parotid glands, 33 to 46% from the submandibular glands, which sit under our lower jaw, and the sublingual glands, about 5%. But overall, we produce about 1 to 1.5 liters of salivary fluid each day. Saliva is a composition of 3 different types of fluid. The serous flow, which is a thin flow, comes from the parotid gland. The thick, heavy sublingual flow from under your tongue, and also the submandibular, which is a mixture of loose, thin saliva and the heavier mucous saliva. And the composite is saliva. Next slide, please. So what is in saliva that makes it so important? And it is very complex, as we know. Lots of enzymes and proteins, and they all have a very specific purpose. Electrolytes, sodium, carbonate, and many others. The electrolytes help preserve teeth and have a role in mucous membrane biology and stability. Organic molecules, glycoproteins for surface interactions, and growth factors, which also are important in maintaining oral mucous membrane health and function. Next slide, please. So, what are the protective functions of saliva? Well, lubrication, of course, and that lubrication is mediated through water, mucins, various glycoproteins, all affecting the surface of the mouth and the throat and the oropharynx. There are many substances in saliva that produce an antibacterial and antifungal, as well as an antiviral effect, and these are mediated by histatins, cystatins, secretory IgA, many glycoproteins, all of which combined produce what we call bacterial and microbial homeostasis, or balance. The integrity of the mucous membranes, as I indicated a moment ago, is based upon the presence of mucins, electrolytes, and of course, water. Cleansing, the detergent action of water in saliva, of course, washes away a lot of food and debris, which is ultimately swallowed and cleared. Importantly, and very importantly, saliva has a very important buffering capacity, where the pH of saliva is maintained, the pH of the oral cavity is maintained at approximately 7.0, and this primarily from bicarbonate, phosphate, and protein buffer systems, which maintain pH at approximately 7.0. Not to be lost in all of this is the role of saliva in maintaining integrity of teeth, and by that we mean the presence of calcium, phosphates, and other very important compounds that are not ionic that keep teeth healthy and intact and keep mineral contents high. Next slide, please. Saliva prepares food for digestion by way of certain mucins. Amylase, which starts the reduction of complex starches into more simple sugars for resorption. Taste function, not to be dismissed at all. There are certain things in saliva known as gustins and proteins, in addition to water, which help solubilize food, allowing us to taste and enjoy what we eat. And of course, communication. Speech is affected negatively when we don't have enough saliva. The tongue sticks to the palate and the lips and cheeks, and our diction and articulation suffers. The next slide, please. So, with dysfunction of saliva or salivary glands, mucous membranes are changed. We have an increase in dental decay or dental caries and gum disease or periodontal disease, an increase in fungal infections because there are many naturally occurring antifungal compounds in saliva which keep yeast counts or fungi down. or limited. Problems in swallowing or dysphagia or painful swallowing, odynophagia, is well known to those who have severe and persistent dry mouth. We mentioned speed abnormalities a moment ago, and we also mentioned taste alterations, which are basically indirectly related to salivary dysfunction. Next slide, please. This is a classic view of the tongue in a person who has autoimmune disease, Sjogren's syndrome, where the tongue assumes this classic cobblestone appearance, which is observable very quickly and very easily. You do not see any moisture on this tongue, and the typical papillary structures of the tongue are gone. Next slide, please. So, what about cancer, oral and head and neck cancer? A common disease, about the sixth most common cancer in the body, 40,000 new cases a year in the oral cavity, oropharynx, and voice box or larynx. Most of those cancers are squamous cell carcinomas. Patients are middle-aged or older. 59 years is the average age for head and neck cancer patients. Males dominate 3 to 1 over females because men smoke more than women do as a rule. Adverse effects of radiation we've already talked about, basically damage to the tissue that produces saliva, if not actual death of tissue that's directly radiated, and therefore salivary diminution. And when salivary gland tissue is destroyed, it is hard to recover salivary flow, and therefore xerostomia results. The next slide, please. Fortuitously, we have a patient such as this with an intact oral cavity. The dentition is, as you see, in good shape. His hygiene is good. But after a period of time with severe xerostomia, there was significant dental breakdown. The next slide will show you. In spite of good dentistry, careful dietary management, and so forth, he still developed lots of decay and had the cavities fixed by one modality or another, be it silver fillings or so-called composite restorations. But this is what can happen in a fairly short period of time in the absence of adequate oral treatment in the presence of dry mouth or xerostomia. Next slide, please. This is a little focal area of yeast growth or candidiasis or thrush in the dry mouth patient. The next slide. So, the unmet need of folks suffering from xerostomia, millions of folks in the United States and worldwide are affected negatively when xerostomia is present. Multiple causes, as I've said, radiation therapy, medications, autoimmune disease, and necessarily so, a huge impact on one's quality of life, from speaking to eating to swallowing and just living a normal life. And the treatment options we have, unfortunately, and that becomes important because we have to find new ways of affecting a better result from interventions by medications, radiation therapy, and so on. Next slide, please. So how do we deal with it? Saliva replacement, lubricants, and there are many lubricants out there, and moisturizers, which do provide some level of improvement of function or a level of comfort, maybe. Gustatory stimulation, we can have individuals try sugarless gum, sugarless candies. Anything that's going to stimulate taste improvement will reflexively have a positive effect on salivary stimulation. Prescription drugs, there are basically two in the United States that we use, pilocarpine or Salogen and cevimeline or Evozac, and they have made a big difference, but it is an incomplete restoration of salivary flow. Devices, there are devices out there at the moment with electrical current stimulation that are showing excellent promise, and I urge people to look into that as well. Prevention is key. Prevention of negative side effects of xerostomia in terms of the mucous membrane and the dental structures is crucial, and your dentist has a role to play in all that. And then daily tricks of living, maintaining a closed mouth posture, moisturization of the lips, sips of water during the day, and bits of stimulation by virtue of little mini pieces of fruit, something to stimulate salivary flow when there's salivary gland tissue that can be stimulated. Next slide, please. Electrical stimulation, as I mentioned before, and importantly, and my last slide, I guess, is the work that's currently being done about gene transfer and genetically modified genetic components which are directly delivered into the salivary gland based upon the work of Dr. Peter Eggery at Johns Hopkins many years ago, which won for him the Nobel Prize in chemistry. So aquaporins there are many, many aquaporins, but aquaporin 1 is a water channel that can be restored, hopefully, with transfer of the appropriate gene that produces the protein aquaporin. And if those aquaporins are placed properly, the aquaporin genes placed properly, salivary glands can show increased level of fluid transport and therefore function. There's a lot going on, and I urge you to keep your ear to the ground and follow aquaporin research, but based upon Peter Eggery's research at the University at Johns Hopkins. In fact, that research was funded by Michael Bloomberg within the Bloomberg School of Public Health at Johns Hopkins. Next slide, please. And finally, when you have enough saliva, you can watch your grandson fly his kite on a summer day in Vermont. This is my grandson, Andrew, many years ago, visiting his aunt's farm in Vermont, flying a kite. How beautiful. That's all I have. I hope I was able to give you some information in a very brief, rapid, and telegraphic way to give you a little bit of a better background as to what saliva is, its importance, and how to deal with it when its function is being impacted. Thank you very much.
Thank you, Dr. Shuba, for those very enlightening and informative comments. Now I'd like to welcome our moderator for today's meeting, James Valentine, who I've gotten to know over the last several months as he's helped us plan this meeting. James has worked for the last 13 years as a champion for the patient voice. James previously worked at the FDA, where he was a patient liaison, helping to incorporate the patient voice into medical product review. There he helped to develop and launch the Patient-Focused Drug Development Initiative. In private practice, James has worked with many patient organizations to ensure their community's voices were heard by decision makers. Relevant to today's meeting, James has been involved in helping plan and moderate 3/4 of the nearly 50 externally led PFDD meetings. So we are in good hands with James.
Thank you, Amanda. So now that we've had a chance to hear a clinical overview from a disease expert, we turn to the core of today's meeting, which is to hear from you, individuals living with xerostomia and their direct care partners and caregivers about the experiences of the person living with xerostomia. As you've heard, patient-focused drug development, or PFDD as we call it, is a more systematic way of gathering input from patients and their perspectives on their condition and on available treatments. As you heard from FDA's Dr. Kendall Marcus, your input can help inform the agency's understanding of xerostomia to inform drug development and review. As you also heard, FDA is very committed to the Patient-Focused Drug Development Initiative, and they actually themselves have hosted many PFDD meetings. However, with the externally led patient-focused drug development effort, today marks the 48th such meeting, and due to the ongoing COVID-19 pandemic, today is actually the 15th fully virtual externally led PFDD of its kind. With over 10,000 known conditions, this is a very unique and important opportunity for this patient community. Today's meeting is interactive, so I'm going to tell you a little bit about what we'll be asking of you and how today's meeting will be organized. First, we'll be exploring the patient and caregiver experience of living with xerostomia and its impacts on your daily life. Then, in a second session this afternoon, we'll bring everyone back together to explore the various approaches to treatment. We'll also be asking about your preferences for future treatments during that session. So what will our discussions look like? We'll be using a variety of methods to hear from you throughout the day. We'll start each of our 2 sessions hearing from a panel of individuals living with xerostomia or their care partners. This will help set a good foundation for our discussion, as they've been selected to reflect a range of experiences of what it is to live with xerostomia. But knowing that no panel of people can reflect the full range of experiences, really they're there to set that foundation that we'll build on in a broader audience discussion with all of you, our patients and our caregivers who are tuned in live today. Your input will build on that panel feedback. I'll be asking questions and inviting you to provide comments. This can be done in one of two ways, which we'll talk about how to do specifically later, but we'll be asking you to dial in by phone or to provide written comments throughout the day that we'll be sharing live. You'll also see that we'll have a Zoom panel of patients and caregivers participating in the live discussion as well. I also want to mention the last way that we'll be getting your input, which is through polling questions. These are questions for our patients and caregivers only, who will ask to use your phones to respond to questions that we'll be posing. This is something that you can go ahead and get into this system, because once you're in, you'll be able to stay in that system throughout the entire day today. As we advance through questions, you'll be able to just go back, look at this website, and the questions will be there for you to answer. And so at this point, you can go ahead and pull out your phone, open up your browser, or if you're following along on a computer today, you can also open a new tab and go to pollev.com/xerostomia. That's Xerostomia. Again, that's pollev.com/xerostomia. And we'll be going to polling questions very soon. These questions will allow us to broaden the conversation and get input from everyone that will help aid in our discussion. I also want to mention that you'll have an opportunity today to provide written comments for 30 days after the meeting. All of this input will be summarized in what is called a Voice of the Patient report, a summary report for today's meeting, which will be provided to the Food and Drug Administration, as well as be made available for researchers and drug developers. So one last thing before we get started and go to that first set of polling questions, I want to cover a few ground rules for today. So we encourage individuals with xerostomia and their caregivers to contribute to the dialogue. Again, you can do that through polling, by calling in by phone, or providing written comments in that little text box below the live stream today. We do limit today's discussion to those individuals with xerostomia and their family members and other direct caregivers only. For those of you from the Food and Drug Administration, from drug development companies, or clinicians, we welcome you here to listen. I also want to mention that views today are going to be inherently personal that are shared, and the discussion may in fact get emotional. So respect for one another is paramount, and to that end, we do ask that you try to be focused and concise when you do share your comments, so that way we can hear from as many voices as possible. So without further ado, let's get into it and get to our first set of polling questions, which are some demographic polling questions. These questions are designed to allow us to have a sense of who we have in our live audience today. Again, these polling questions are only for our individuals living with xerostomia or direct caregivers and care partners. So again, you can open up a browser on your phone, that's the preferred way, or you can open a new tab on a web browser on your computer. Go to pollev.com/xerostomia. This should be displayed on the live stream that you're seeing right now. So you can go ahead and get to that web page. And you'll see our first question for you is a simple question. We want to know, who are you? Are you either A, an individual that's living with xerostomia, or are you B, a relative or care partner of someone living with xerostomia? So we'll give you a few moments to get into this system so you can answer this first question. And again, once you're in the system today, you can just keep this web page up. And as we advance through polling questions, which we'll come back to periodically throughout the program, those questions will be displayed for you. You'll be able to answer those and share. That way we can share these responses in real time live today to understand your experiences with living with xerostomia. So while this may be the simplest question that we'll ask today, we are giving you a little bit of time here to get into the system. We want to make sure that everybody can get in and access the polling. That way we are able to capture your responses from this very first question. Okay. So I think what we saw from that first polling question, we've advanced to the second one here, but that the vast majority of our participants here today are actually the individuals living with xerostomia. However, we do welcome those of you who are our caregivers and care partners. We do want to hear from you as well. So in addition to answering these polling, please do feel free to call in. We know that sometimes you observe things about the person that you care for and their experiences with this condition. So thank you all for joining. Our second polling question here for you is we want to know where you reside. And so the options are A, the U.S. Pacific time zone, B, U.S. Mountain time zone, C, in the U.S. in the Central time zone, D, in the U.S. in the Eastern time zone, E, U.S. Alaska time, F, U.S. Hawaii time, G, Europe, H, the Middle East, I, Asia, J, Canada, K, Mexico, L, Australia, or M, some other country or region not reflected on this slide. So we'll give you just a couple more moments here. I promise these questions will get both more interesting maybe, but also more, I can promise, more difficult as the day goes on in terms of needing to think about your responses here. But maybe not surprisingly, we are seeing the majority of our participants from the United States. And within that, we're seeing the largest cohort from the Eastern time zone. However, we do have good representation across the U.S. as we move to Central, Mountain, and Pacific times. I also like to welcome our participants who are from Europe, Canada, and Mexico, as well as I see some from the U.S. Hawaii time zone. So good representation here from those of you from across the country and some of you from outside of the U.S. So all of your voices are important to hear today. We go to our third polling question. So here we want to know, are you, and if here you're a caregiver, answer this about your loved one who has xerostomia. Are you or are they A, female, B, male, C, non-binary, or D, you prefer not to identify? So again, and this is a good point to bring this up. From here on out, we're going to be asking questions that are about the person living with xerostomia. So for those of you who are caregivers or care partners, do not answer on behalf of yourself. So here, if you're, the person with xerostomia who you care for is A, female, that's what we'd like you to answer. Do not answer this on behalf of yourself. So what we're seeing as it stands now is pretty close, 50-50. Now, as we are always, the data is constantly changing this on us, exactly 50-50 distribution between female and male individuals living with xerostomia. So if we move to our fourth demographic polling question. So this question is, how do you or your loved one with xerostomia self-identify? And here you can select all that apply. The options here are A, for Hispanic, Latino, or of Spanish origin, B, American Indian or Alaskan Native, C, African American, D, Native Hawaiian or other Pacific Islander, E, Caucasian, F, if you prefer not to identify, or G, some other race or ethnicity that is not listed on this slide. So we'll give you a few more moments. We want to make sure we capture everybody's responses as we move through these demographic polling questions. So what we're seeing is while the predominant experience or those that are participating today are predominantly Caucasian, we are seeing representation from the Hispanic, Latino, or of Spanish origin population, as well as African American, as well as other, so race and ethnicity that's not listed on this slide. We can move to our fifth polling question. So here we want to know how old are you. If you're a person living with xerostomia, how old are you? If you're a caregiver or care partner, how old is your loved one that's living with xerostomia? And the options here are A, are you between 0 and 17 years of age? B, are you or your loved one between 18 and 30 years of age? C, 31 to 50 years of age? D, 51 to 60 years of age? E, 61 to 70 years of age? Or F, 71 years of age or older? Again, this is for those of you living with xerostomia, please denote your age. And if you're a caregiver or care partner, please denote the age of the person who is living with xerostomia. So as it stands, it looks like we have about a third of our participants today. The person living with xerostomia is between 61 and 70 years of age. We have about a quarter, both representing 51 to 60 years of age, as well as 71 years of age and older. And then a little over 10% representing the 31 to 50 year age range. We do not have anyone living with xerostomia represented at age 30 or younger. If you can move to our next polling question. So this is, you'll see the same age range options, but here we want to know at what age did you or your loved one first have xerostomia symptoms? And so the options are the same: A, 0 to 17, B, 18 to 30, C, 31 to 50, D, 51 to 60, E, 61 to 70, or F, 71 or older. So as the results are coming in, we're seeing that there's a shift here. We're seeing that a little bit of a earlier shift with symptoms, first symptoms of xerostomia, with the predominant or most common experience being that they first came during age 51 to 60 years. After that, 31 to 50. We're seeing, still though, some having their first symptoms 61 and older. And you're even seeing here, whereas nobody currently is in these age ranges, their first xerostomia symptoms did occur age 30 or younger. We can move to our seventh polling question, please. So here we want to know what led to the development of your or your loved one's xerostomia, and we want you to select one here. So we know that perhaps maybe multiple things contributed. What was the primary contributor, at least as best as you can assess, of your xerostomia? The options here are A, chemotherapy, B, radiation therapy, C, surgery on a tumor of the head or neck, D, some other drug reaction or side effect, E, Sjogren's syndrome, F, diabetes, G, rheumatoid arthritis or lupus, H, hypertension, I, hepatitis C, J, if you're unable to determine the cause, K, some other cause not listed here, or L, if you're just not sure, you don't recall. So we'll give you a few more moments here to get in your responses. One thing that is looking pretty solid is that about 3/4 of those represented here today, their xerostomia developed as a result of radiation therapy. However, we're seeing quite a diversity of other things that led to developing xerostomia, including surgery on tumors of the head or neck, other drug reaction side effects, Sjogren's syndrome, diabetes, and some other things that aren't even listed on this slide, which of course we want to encourage you, even if whether you're in the more common radiation therapy, one of these maybe less common, more rare causes, or even something other that's not listed here, to call in, to write in. We want to hear how your xerostomia has affected your life. We do see that some are unsure and or unable to determine the cause as well. If we go to our final demographic polling question. Oh, sorry about that. Actually, that was our final demographic polling question. So I want to thank you for sharing these experiences. It helps us have a sense of who we have in our audience today, which is really helpful. But now we get to move to that first topic that I had previewed. We want to hear today about what it is to live with xerostomia. And so in our first session, I'm going to ask that we pull up our discussion questions. We're going to be first looking at what are the symptoms and direct health effects of living with xerostomia, and how do those symptoms and health effects impact your daily life. So we're going to ask you to not only tell us what are the range of symptoms of xerostomia that you experience, but actually think about which of those have the most significant impact on your or your loved one's life. We know that those symptoms of xerostomia may be different. They may be different day to day, so we want to know about your best days versus your worst days. We also know that those symptoms might change over time, whether that's week to week, month to month, or even over the course of years. So we want to hear about those changes and what those looked like. And importantly, in addition to hearing about the direct symptoms and health effects of xerostomia, we want to know about the activities that are impacted. So think about those specific activities that are important to you or your loved one that you can't do either at all or maybe as fully as you would like because of xerostomia and its symptoms. And finally, knowing that not all of your experience with xerostomia has occurred and you'll be living with xerostomia into the future, we want to know, what are your fears, what are your concerns, what are your worries about you or your loved one's xerostomia in the future as you get older. So to help us understand some of these questions and to start this discussion, we have a great panel of patients and caregivers who will be sharing their xerostomia stories. We have Ron, Ada, Hank, Jeffrey, and Judy who will be providing some statements. So Ron, please take it away.
My name is Ron, and I live in Palm Springs, California, with my husband of 43 years, a dog, a cat, and 2 parrots. I was diagnosed with stage 2 squamous cell carcinoma of the tongue and had approximately 1/3 of my tongue removed. Even with part of my tongue removed, I was able to eat normally and could speak fairly clearly. However, after about a month, it was determined that I needed radiation therapy 5 days a week for 6 weeks. I experienced painful mucositis as a side effect of the radiation, and then developed xerostomia, which made the mucositis much worse. The xerostomia made my mouth dry, and the sores would dry out, break open, and bleed. This was the worst at night. The combined effects of the xerostomia and mucositis lasted throughout the radiation treatment and for about 2 months after it was over. I'm nearly 3 years past the last radiation treatment, and the xerostomia has persisted. Xerostomia makes my saliva flow low and is often very thick and sticky. This makes speaking difficult. Not only do I have to deal with adjusting my speech to compensate for the missing part of my tongue, but the dry mouth and sticky saliva make my tongue stick to the roof of my mouth, and I start slurring my speech. Sometimes the sticky saliva closes the back of my throat, and I can't speak for up to a minute. My throat is just stuck, and I'm not able to get words out. This is really embarrassing, especially when it happens during a conversation or a presentation at work. I think people wonder if I'm choking or if I have Alzheimer's disease and just can't think of a word. The minute seems like hours of having people stare at me, and I feel helpless because I can't tell them what's going on. I drink a lot of water and use chewing gum to keep my mouth moist during the day, but I still have difficulty swallowing certain foods. Baked goods, no matter how moist, tend to change the quality of my saliva to very thick and sticky form that turns a mouthful of food into a ball of glue. This is very difficult to swallow unless I wash down every small mouthful with liquid. I have to eat slowly, which means I'm always very careful of what I order when I'm out at a restaurant with friends. I try to find something easy and non-embarrassing to eat. Nevertheless, I'm always the last one eating while everybody else has to wait for me. Nights are challenging. My mouth gets very dry at night to the point that my soft palate gets sore. Given the increased water consumption during the day, I find that I have to get up several times each night to use the bathroom. To minimize my mouth drying out, I use Xylomelt tablets and try to keep my mouth closed by sleeping on my side with a pillow wedged between my chest and chin. While this works, it disturbs my sleep because I have to be conscious of repositioning the pillow whenever I change position. This leads to a cycle of about 2-hour sleep periods that are interrupted by bathroom trips, getting another Xylomelt, and pillow adjustments. My work is demanding, so I don't have the opportunity of sleeping in during the week to make up for lost sleep. This can leave me tired during the day, but I'm lucky because my work is interesting and challenging enough that I can usually muscle through the day. On the other hand, my free time is more impacted. For example, if I'm sitting with a group of friends in a casual conversation and I'm not really engaged in talking, I may just fall asleep in front of everybody. So now my friends either think I'm rude or that I'm really sick. If you look up xerostomia on Google, the definition is abnormal dryness of the mouth due to insufficient secretions. This doesn't give any idea of its impact. For me, the definition of xerostomia is abnormal dryness of the mouth due to insufficient secretions that affect speaking, eating, swallowing, sleep patterns, and social relationships with my friends and work colleagues. I think that if I could have one thing to deal with this, it would be a spray that would last at least 8 hours so that I wouldn't have to drink so much water during the day and that I could keep my mouth moist all night so that I could finally get a good night's sleep. If it could also prevent the stickiness, that would be a big help. Thank you for your consideration.
Hello, my name is Ada Valdez and I live in Miami, Florida. In the fall of 2018, I found a lump on my neck right under my jaw. After several doctor appointments and an inconclusive biopsy, I had a neck dissection and tonsillectomy. A week later, I was diagnosed with HPV-positive squamous cell carcinoma. Fortunately, my doctor found the focal point on my left tonsil. It had migrated to my lymph nodes, which is where I felt the bump. After a short recovery, I began treatment of radiation and chemo. Hearing the word cancer was truly the toughest and scariest sound I had ever had to listen to. It knocked the wind out of me. The fear was overwhelming. But thankfully, the strong support I had from family and friends never let me drift into a dark place. I had faith this was literally a bump in the road of my life's journey, and I put all trust in my physicians and in God. After 6 rounds of chemotherapy and 33 rounds of radiation, I finished treatment and rang the bell on February 8, 2019, surrounded by my loved ones. I refer to life after treatment as my new normal. Some of the things I lost, hair and taste, came back, but some did not. Before beginning treatment, I was told that radiation would affect all aspects of what goes on in my head and neck. Hearing, swallowing, tasting, balance, memory. I was told that most of these aspects would eventually return back to normal, but in my case, the lymph drainage and the saliva production did not. So my new normal is living with lymphedema and xerostomia. Saliva production is a normal bodily function that we all take for granted, and I really didn't think it would be a big deal to lose some of its functionality. I also thought it was going to be temporary. In hindsight, I was more focused on beating this illness than worrying about the side effects along the way. However, not having normal saliva production has affected me in several ways, the most negative being how it has affected my sleep. Even though I am able to fall asleep quickly and do sleep soundly, I wake up often during the night because of very uncomfortable and at times painful parched mouth and throat. I began using Xylem tablets, which has helped alleviate some of the dryness, but it's definitely not the same. Xerostomia has also affected what I eat. I can no longer enjoy crusty breads or thick foods because I could literally choke. Without the lubrication from the saliva, these types of food sticks to the side of my mouth and throat, making for some very uncomfortable eating and swallowing. I have had incidents of painful swallowing even from foods that are not thick, as there doesn't seem to be enough liquid in my mouth to propel or lubricate the food down my throat. Aside from painful swallowing, I've had a couple of incidences of almost choking, again due to food getting stuck in my throat. Wine and cheese is not as fun as it used to be. It's been more than 2 years since I finished treatment, and I haven't noticed any change or improvement in the saliva production. I have continued to seek lymphedema and neck therapy to keep my quality of life. I have found that if I don't exercise my neck or continue these treatments, the xerostomia does get worse to the point where I develop hoarseness and tightness in my throat. My future dental health has also become a topic of prime concern. My understanding is that saliva and dental health go hand in hand, so my fear is that my lack of saliva will cause further deterioration than what is expected from normal aging. Even though my insurance will not cover all of them, I now have 4 cleanings per year instead of 2, so there is an additional healthcare expense. My dentist has counseled me on products that can relieve xerostomia. He advised not to use any products with alcohol, so I've changed my toothpaste and mouth products to Tom's and biotin. While xerostomia has not excluded me from the activities and interactions with others, it has changed my way of life. Along with the fear of cancer recurrence, I fear for my dental health and my nutrition, and most importantly, my sleep. These are important factors for a healthy life, especially as one ages. I do my best to try to maintain a positive attitude, and I continue to seek relief.
Hello, my name is Hank, and I am from Union, Ohio. Symptoms of xerostomia came early in my cancer treatment, as I already could not swallow and had a feeding tube inserted shortly after my biopsy. Dry, burning tongue, voice changes followed by thick, sticky saliva made me feel uncomfortable in both a physical as well as a social manner. This persisted throughout my treatment, especially around my grandchildren, as they came to view me as this monster in the room when they came to visit. As treatment continued and dry mouth continued, the natural reflex of swallowing was gone. People normally swallow saliva unconsciously throughout the day, creating that automatic reaction. Combined with radiation, I developed a frozen epiglottis, requiring speech swallow therapy when treatment concluded. A feeding tube that placed before I started treatment due to the location of the tumor that was already impeding my ability to swallow, and with the dry mouth, I developed acid reflux and am on proton pump inhibitors for life. Therapy for speech and swallow followed for almost a year after my last chemoradiation session from these complications. My cancer docs had me on pilocarpine, but that only increased sweating and not saliva. Despite faithfully using dental trays and good oral hygiene, I developed dental caries to the point of my family dentist referring me to an oral surgeon for care. Saliva is the oral cavity's natural cleansing agent. Without adequate saliva, dental decay, that is, caries, gingivitis, plaque, mucosa, and periodontal disease, can occur and lead to infections. However, the damage had already been done, and my teeth were beyond being saved, so a treatment plan was being put in place to remove all teeth and go to dentures. Before the surgery, a major oral infection hit, and I had to have emergency surgery. Patients with a systemic illness are at a greater risk for an abscess complication called Ledward's angina, an infection that starts under the tongue, quickly spreading to the floor of the mouth and into the neck. Although Ledward's angina is a rare complication, immune-compromised patients can have life-threatening complications of airway obstructions, pericarditis, and other infections. The oral surgeon discovered necrotic bone and tissue from the 4 teeth involved in the infection and rushed the hyperbaric treatment plan and a second surgery to remove all remaining teeth, necrotic bone, and then place 6 implants and refer me to a prosthodontist to build a bridge for the implants and an overdenture. Over the past 12 years, I lost 2 of the implants as a result of failing bone and a defect that cannot heal despite 20 post-surgery hyperbaric sessions, bone morphogenic protein, and stem cell transplants. Xerostomia causes periodontal disease, which leads to the loss of gum tissue and bone that support teeth and/or implants. My oral surgeon and prosthodontist have diligently monitored and cared for my jaw and lower cavity over the years. However, due to the continued xerostomia, on May 4, 2021, my entire implant structure fell out of my mouth, and now I get to start this whole process over again. My xerostomia symptoms have been reduced since I started using medical acupuncture. I monitor closely how much saliva I produce and get a boost when I need it. What has changed is that with the dentures, I do not get enough saliva to the back of my mouth and have some difficulty with swallowing some medications, those that cannot be crushed. I also have changed my eating to smaller bites, more soft and moist foods. And due to the dentures and my jawbone, I cannot properly chew or masticate some foods, such as leafy vegetables. This has led to impaired nutrition and relying on supplements, borderline cholesterol numbers, and a condition called dysphagia, which alters the quality of life. Christmas Eve, Polish Christmas Eve Wigilia celebration, is a centuries-old tradition that has been passed down from my grandparents to my dad, and from my dad to me, and I will eventually hand it down to my son. Beginning at sundown on Christmas Eve with a specially prescribed menu, a visitation from Starman, the Polish Santa Claus for the children, and ending with the animals being able to speak to each other. That and Thanksgiving has always been a full family gathering of kids, grandkids, and now great-grandkids with a traditional Polish food fest and partying. Something that in the last several years my grandkids have noticed that their pap does not really eat, but spends his time preparing and serving the food. They also notice that at other family gatherings, birthday parties, or cookouts, I never have a plate of food, just a few soft delicacies and a beverage. Fear of aspiration of food, having to choose eating or carrying on the conversation with my family is the choice I'm left with. My wife and I rarely go out to eat or socialize with friends if familiar is involved due to the swallowing issues with xerostomia. The need to take constant sips of water, no ice, to help get the food down. Having to use a hard swallow technique when food gets stuck is embarrassing. Not being able to enjoy coffee, tea, or soft drinks because of the caffeine that dries out the mouth more than staying with the soft liquid menu choice. Eating is an exhausting experience by itself, making it hard to have good conversation and good food at the same time of enjoying good friends. Special equipment has had to be purchased over the years to accommodate battling xerostomia. I sleep with a humidifier in the bedroom year-round. I have a personal humidifier for winter and allergy season to help clear out mucosa before I can eat. On the medical side, extensive speech and swallow therapy, barium swallow tests every few years, and extensive dental care are part of my life now. Thank you very much.
My name is Jeffrey Palmer. I'm a retired physician. My medical specialty is physical medicine and rehabilitation. I'm a professor emeritus at Johns Hopkins University, where I've had a wonderful career. I saw patients, had my own research laboratory, and traveled around the world doing research and teaching. When I was a teenager, I was hit by a car while I was walking across the street and had multiple injuries. I've had neck pain ever since. The severe neck pain forced me to retire about 6 years ago. I've also had dysphagia, that is trouble swallowing, due to xerostomia for 30 years. The xerostomia and the neck surgeries made my swallowing much worse. I did a lot of teaching and lecturing in my work. I became well known as a speaker and gave hundreds of lectures and seminars, many of them in Asia and Europe. The xerostomia gives me a dry mouth and throat and a hoarse voice. That interferes with my speaking, so I had to reduce my commitment to teaching and traveling. It was an enormous blow to my career as a professor and a teacher. I was even nervous about giving this short presentation. The xerostomia seems to be due to my diabetes and side effects of several medications. My mouth is constantly very dry. I wake up during the night and in the morning with my mouth and throat feeling parched. My tongue sticks to the roof of my mouth. My voice gets hoarse, and even on my best days, I have constant uncomfortable dryness with trouble swallowing. The xerostomia started when my diabetes was first diagnosed. I first noticed dry mouth and throat with a hoarse voice. It improved with treatment of my diabetes, but then gradually got much worse. Now the dryness is a constant problem. I often have choking and coughing spells. The xerostomia makes my swallowing much worse because food gets stuck in my throat and won't go down. Sometimes I feel a sense of panic because the food blocks my airway and I struggle to clear it. I can usually control the panic by mindfulness techniques. I tell myself to relax and just wait for it to get better. That usually takes care of it, but the coughing and choking are embarrassing for me and my family, especially when I eat around other people. If there was one symptom of xerostomia that I could eliminate, it would be the dysphagia. I never know when I will start coughing and choking. Another problem with xerostomia is that it makes me vulnerable to recurrent infections in my mouth and throat, especially oral thrush, also known as a yeast infection of the mouth and throat. I had surgery recently for an unrelated problem. It required 5 days of antibiotics. On the second day, I noticed that my tongue was sore, and that next day, it had a white coating from the thrush. The pain and dryness in my mouth were as bad as the surgery. On a bad day, my neck pain is almost unbearable. It is hard for me to walk or even get out of bed. With the xerostomia, I wake up feeling parched and my tongue hurts. My voice is hoarse and it's hard to swallow. I often cough and choke, and my family is afraid I'll stop breathing. When I eat, food gets stuck in my throat. It's hard to get the food to go down, especially dry foods, and I start to cough and choke. Large pills are particularly difficult. I used to avoid eating in public because of the embarrassment, but I've changed my attitude. I don't let embarrassment keep me from enjoying myself by eating out with my family and my friends. As I get older, I worry about what will happen to me. I'm incredibly frustrated by all these limitations in my life. I already need to use a cane when I walk. In the future, will I be able to walk at all? Will I be able to eat a normal meal? Will I be able to eat in public? Will I lose my voice? Will I wake up parched and uncomfortable every single day? I'm frightened of becoming more disabled, but I know it's inevitable. So I do my best to take good care of myself by watching my diet, exercising, and getting great medical care. A speech pathologist taught me some techniques that help me swallow and take care of my voice. My life is better because I have great relationships with my family and friends. And I never give up hope that medical research will someday find better treatments for my xerostomia. Thank you very much.
Hi, my name is Judy and I live in New York. 4 years ago, I embarked on a 3-week tour to Japan that included several weeks of cycling in the countryside and mountains and sightseeing in 2 cities. Prior to leaving, I had met with my doctor who shared preliminary findings from tests focusing on a swelling on my neck. She had noted a likely tumor and referred me for additional testing, but encouraged me to go ahead and schedule the appointments after the trip ended. Once I returned, I was diagnosed with a malignant neck tumor and underwent a 5-hour surgery and subsequent chemotherapy and daily radiation treatments. At the inception of the surgery, I knew the goal was to remove the tumor, but didn't anticipate the loss of salivary glands and the multiple problems this loss would create. As it turned out, the surgery included removal of salivary glands, a facial nerve, and lymph nodes, and subsequent radiation increased the mouth dryness triggered by loss of the salivary glands. I emerged from the ordeal physically and emotionally exhausted. Once the wound had healed and radiation chemotherapy treatments ended, I returned to my regular lifestyle. But it was not regular at all. My ability to eat normally was severely impaired. I could chew on only one side of my mouth. I couldn't handle hard, crumbly, sticky, or stringy foods, and hot, spicy, and citrus food was painful and left my mouth sore and the roof of my mouth swollen. In short, there were very few foods I could tolerate. Weekly checks during my routine visits revealed serious weight loss. Not surprising, since extreme mouth dryness and sensitivity to a wide range of foods severely limited my food choices. Never a meat eater, I could no longer eat my staple dishes: chicken, pasta, potatoes, green salads, fruits, and most breads. An avid lover of ethnic foods, Indian, Thai, Middle Eastern, I quickly abandoned those choices. After several embarrassing social occasions at restaurants where I could find nothing suitable on the menu, I started turning down friends' invitations, opting for home-based meals where I could control more my food choices. Restaurant-based parties and social gatherings were and continue to be an embarrassment, since I feel awkward rejecting everything that is offered. Friends try to be helpful and make suggestions, but seldom are they suitable. Crunchy, chewy, crumbly, sticky, grainy dishes don't work. They wind up wedged into or between my teeth, stick to my palate, settle at the gum line, or get stuck on the way down. I find that I eat alone a lot. I think others see me as a social liability. Picnics are a special challenge. Turning down burgers and hot dogs is awkward, and when I also reject potato salad, I feel like a total social misfit. Over time, I have devised an eating plan that enables me to maintain my weight and stay healthy. Formerly a creative cook, I'm now a soup lady, opting for wholesome, thick blends of pureed vegetables. More accepting of these limitations than I used to be, I find myself able to cruise down the aisles at the grocery store without fighting back tears. Food limitations are not the only challenges I face. Equally bothersome is the ever-present mouth dryness. Often my mouth becomes so dry I can't enunciate clearly, and my lips become stiff and cracked. While many people carry water bottles, I can't go anywhere without my bottle, and panic if I wind up out on a stroll without it. Airports present special challenges, as they require that you relinquish all liquids prior to reaching the security checkpoint. Public speaking is another challenge I face. As a college professor, I did a lot of lecturing. Though now retired, I often get invitations to participate in workshops and conferences. When I need to talk aloud for extended periods of time, the spoken words become unclear, and I struggle to keep going. Over time, I have become better at anticipating such situations and make sure I have the water I need. Several years ago, during an appointment with my surgeon, I inquired how much improvement I could expect in terms of mouth dryness, swallowing, and taste. Taking the question in stride, he replied, To some extent, this can be addressed through mind over matter. I listened and sighed, realizing this was my fate.
Wow, thank you, Judy, and to all of our panelists for really digging deep and sharing with us what it is to live with xerostomia, so much more than just dry mouth, as we heard from many of our panelists. But we really want to keep building on this and expand the conversation now to all of you in our live audience. As I mentioned earlier, there would be an opportunity to call in, to write in, and this is that first opportunity. So if you have a experience, a symptom or health effect related to xerostomia or an impact it's had on your daily life, this would be a great opportunity to call in to share your experience. The number you can call in is 1-703-844-3231. Again, that's 1-703-844-3231. If you call in, we'll get you in our queue here so that way we can hear and talk to you live during the program, hear your experiences of living with xerostomia. But to get us thinking about this topic and start to get an understanding of the experiences that you all have, we're going to go back to a quick couple of polling questions that we have. So pull that phone back out, open up that browser, go to that other tab you had open. As a reminder, that URL is pollev.com/xerostomia. It's the same one as earlier. You can keep that open all day today, and all our polling questions will be showing up there. Our first polling question for you today in this session is, which of the following xerostomia-related health concerns do you or your loved one have, or maybe have had? And here we want you to select all that apply. So the options are A, dental caries or cavities, B, altered taste, C, cracks in your lips, D, trouble chewing and or solids sticking in your teeth, E, trouble swallowing, F, ulcers on the tongue and in the mouth, G, oral pain or burning, H, oral candidiasis or infection, I, salivary gland infection, J, halitosis or bad breath, K, issues communicating verbally, L, fatigue, M, malnutrition, N, mood changes like depression or anxiety, or O, some other xerostomia-related health concern that's not listed on this slide. And again, please select all that apply. So we know that you may experience many or multiple symptoms, and we want to know what those are. One thing I'd like to point out is when we have these polling questions where our participants are able to select more than one option, we're seeing a percentage of responses. So that's not, for example, 12% of everyone that's participating has experienced dental carie or cavity. That's 11% of all of our responses reflecting there. So when you see these bars, think of this more of like a ranking. The larger the bar, the more overall it has been experienced. So as it stands, I mean, one thing that just sticks out immediately is how everything on this list has been experienced. Certainly some things have been experienced a little bit more than others. We're seeing kind of in the top tier, trouble chewing and solids sticking to teeth, dental caries and cavities, altered taste, trouble swallowing. Maybe in a second tier after that, we're seeing issues communicating verbally, oral pain and burning, and fatigue. But then we're seeing a widespread across, all of the other symptoms. Perhaps the thing that's been least experienced amongst our participants today is salivary gland infection. But we really want to hear about this range of different symptoms, perhaps how having multiple symptoms interrelate to each other and might impact your life having to manage multiple of these things. So if we go to our second polling question. So now, thinking about those same xerostomia-related health concerns, we want you to select the top 3 that are most troublesome to you, either something that you currently have or you've had in the past, which has been most troublesome to you. So I promise that these would get a little bit more difficult. I know all of these xerostomia related symptoms are can be of great trouble and great concern, but please try to select the top 3 that are most troublesome to you or your loved one. Again, and just as a reminder, these are percentages of responses we're seeing. As it stands, it looks like trouble swallowing is the, of top 3 most troublesome, seems to be the most commonly selected xerostomia-related health concern that is most troubling our audience today. After that, it looks like it's trouble chewing and or solid sticking in teeth, followed by dental caries or cavities and altered taste. However, what I think is really important is, in picking the top 3, despite so many things being experienced by so many, different things really are in the top 3 for many different people. So we're seeing almost everything here selected as somebody's top 3. And so we really want to hear about why that is. Why did you pick, these, up to 3 things as being most troublesome for you? We want to know why that is, what that looks like in your life, how that impacts your daily life. And so now that's going to move us to the live audience discussion. Thank you for participating in those polling questions. I want you to think about these questions. I want you to call in. You can call in at any time at 1-703-844-3231. We'll get you in the queue. We'll have a conversation. But to get our conversation started, I'd like to welcome our Zoom panel that we have here with us today, some of your peers living with xerostomia. And to get us thinking about this first topic of which of these xerostomia-related health concerns has been most troublesome. As you were thinking about answering that last polling question, what did you pick and why? Gail, maybe you could get us started on this topic. Oop, Gail, you're on mute.
Got it. Hi, my name is Gail, and I am currently living in Rehoboth Beach, Delaware. I'm a retired psychotherapist, and I chose the dental one, which is really interesting because I had my last treatment June of 2018, and I've been very much all my life a stickler for my teeth. And since the radiation treatment, I've noticed that I have broken teeth, fillings have come out. And I know when I went in and had the surgeries and the radiation, they said that could be a side effect. And unfortunately, it's starting to become a reality. So I've made multiple trips recently to the dentist. Just went in last week and had another filling replaced. And it's an ongoing battle. So I think for me, it's a vanity thing because my teeth have been, and my smile have been a piece that I've always been very excited about. So. Sure.
And so how long after that 2018 treatment did you first start to notice some of these, dental impacts?
It's interesting. It's been more recent. I would say in the last 6 months. Okay. Initially, it wasn't an issue, but just seems like in the last 6 months, I have had to get a crown. I've broken just eating like something soft, and the tooth would just break off. Wow. But the interesting thing is the dentist, he doesn't seem to attribute it to the radiation, but then my oncology team thinks that it is perhaps related to that. So we're in the midst of trying to figure out what the cause of these new dental issues are.
And has the the dry mouth itself been present since 2018, or is that also a recent experience?
Yeah, the dry mouth has been consistent, and some days are better than others. Listening to some of the videos, I can relate to a lot of the things that they were saying. It's back and forth. Some days it seems not as problematic, but it's always there. Okay. It's always there, and I also do the water bottle when I'm eating, and even when I'm talking. Like right now, my mouth feels really kind of dry. Mm-hmm. So I kind of try to for me, what I've learned to do is try to manage it all with somewhat of a sense of humor as best I can. So I'll sometimes say I might start to sound like a duck when I'm talking because it gets that dry. Sure. So I mean that's been consistent since the whole end of radiation, which was in summer of 2018.
Sure. Yeah, thank you so much, Gail. Tom, I'd like to bring you into the discussion here, and same thing, as you were looking at that polling question, having to pick amongst those many symptoms, what stood out as maybe most troublesome to you?
Great, thanks for having me on the panel. I'm Tom, I live in New York. I had HPV-based tongue cancer. My last treatment was January of this year, so I'm fairly recent into the recovery cycles. I was surprised that there wasn't a question on your panel about sleep loss or how it affects sleep. I would say that's probably the number one issue that I have now, is waking up in the middle of the night many times with my mouth completely dried shut, which does seem to interrupt my sleep. The biggest daytime issue I have, I can certainly manage the dry mouth with water during the day. I don't have any problem with that. I normally drink a lot of water anyway. But the problem I have is eating. So, and it may be related also to taste bud issues that are a side effect of the radiation, whatever. But I really don't want to eat ever again. And that's pretty bad. So I have to eat, and I lived on Boost for about 3 months, which is one of the worst things that you can ever do. But I'm back to regular foods now, but it's extremely hard for me to eat lots of things, as some other people have mentioned in your videos. It's getting better. And it's very hard for people who haven't gone through this to understand what it's like, but it's kind of like if someone said, here, eat this dead mouse. You could theoretically eat this mouse, but you aren't going to eat it. And most foods for quite a long time were like that for me. And I think it had a lot to do with the dry mouth and not being able to process things would taste like chalk, or they would, just like sand or whatever. It's certainly getting better now a little bit. It can take me an hour and a half to eat a lunch meal, lots and lots of water. I'm drinking probably 6 cups of water at every meal. So that's impacted. I lost about 20 some pounds, and I'm stable now at that lower weight, which is fine. It's probably not a bad weight for me, but eating is definitely one of the big issues for me also.
Sure. And when you talk about almost the unappetizing nature of eating, is that, you mentioned a few things, so I just want to make sure I understand.
Sure.
Part of it is, it sounded like almost like a loss of taste. You don't really get to enjoy the flavor of food. Also, just the difficulty of doing it. I assume that means it's sticking to your mouth. It's really hard to actually chew it. And I didn't hear you mention it, but I'm curious if you've also then had difficulty with swallowing, maybe choking. That we heard a little bit about that as well.
Sure. Yeah. So let me address those if I can. In terms of taste, taste is coming back in sort of odd ways. Some things will be heavily overbalanced, like sour is very overbalanced for me. I used to really like spicy foods. Hot flavors make my hair stand on end. As Gail, I think, mentioned that.
Yeah.
So that's that's an issue, but I'm not sure the taste is the issue as much as the textures. So, and I think the textures are probably related to the dry mouth, where things just turn to this sort of very unpalatable, sandy kind of thing. In terms of swallowing, I had an enormous issues with swallowing and choking and so on during the radiation process, and then for the next month or more. That has gotten better, but it's still a work for me to swallow. And I still try to do the swallowing exercises, like stick your tongue out and swallow, which I do not as often as I should, but I continue to do that. It's hard for me to swallow pills. Someone mentioned that in your videos. Yeah. Large pills are really hard. They get stuck sometimes. So I would say that is an issue. Right. If I manage it with lots of water, and I'm very careful that I don't cough as much, and I've never felt the embarrassment or stuff that some other people have mentioned. Maybe I'm just immune to embarrassment, I don't know, but I don't mind going out. But also I would agree that at a restaurant, there are very few things I could choose. It is getting better, but knock on wood. But yeah, that's another problem with just, I think it does have to do with the dry mouth.
Yeah. Well, thank you so much, Tom, for that. I see actually that we have a phone caller who may want to share and build on this conversation that we're having about eating and taste. And so we have Ellen from California who is calling in to share some of her experiences with these xerostomia-related symptoms. Ellen, are you with us? Ellen, are you with us? All right. We will see if we can get Ellen on to speak with us about those symptoms. But I do also see that we have written comments coming in, again, related to this general topic. So I want to check in with Amanda and see what's been coming in from the
Sure,
web.
we've been getting many written comments, and just really reiterating what both Gail and Tom mentioned. I think Jim from Florida really summed it up when he said, "No food is exciting or something I want to eat again. I'm eating just to survive."
Yeah, thank you. And I want to encourage you to continue to write in. We'll be trying to share as many of those statements as we can. There's a little comment box that's right under the live stream today. You can write in at any time on any of these topics we're discussing about, and we'll be sharing those. So I want to check back and see if we were able to, get Ellen. I know that she has some things that she wants to share on this topic. Ellen, are you with us now? All right, it seems like we're having some trouble getting Ellen. Let's come back here to our Zoom panel. Dan, while we're talking about this topic of still really focused on the direct symptoms and health effects of living with xerostomia, what is it that has been most troublesome, maybe most burdensome for you in your daily life?
Thank you for having me. I just want to give you a brief history of my cancer treatment. So July 20th of 2018, I had my prostate removed, which is unrelated, obviously. And then the following year, May 14th, I had head and neck surgery. I had tonsil cancer and had lymph nodes removed out of my neck. My first treatment was July of 2019. My last treatment was September of 2019. And my biggest issue really is what our fellow panelists said, which was dry mouth at night, sleeping.
Okay.
Mostly all of my food taste has come back. I don't struggle to eat in public, or I'm not embarrassed to eat in public, but I do have to always have water in my mouth on the ready line at all times to wash the food down.
Okay.
If I have water, I can do anything. If I don't have water, I am scrambling somewhere in a restaurant or whatever social setting I'm in to find water immediately, because without water, I'm in bad shape getting that food down.
Okay.
But I don't choke it down and I don't struggle to eat it. I just have to have water to aid in chewing it and getting it into a position to get it down my throat and to wash it down my throat. So water is my savior. I'm sure everybody else kind of feels that way. Sleeping at night is brutal because I wake up, I think it's from my prostate being removed. So I go to the bathroom a lot. And every time I wake up to use the bathroom, I also have my tongue stuck to my throat. My throat feels like it's closed because it's so dry. And again, immediately water is my savior. I take a sip and it all kind of works its way out again. And I go back to sleep, but I really am up every night, at least 4 times, if not 6 times a night, either going to use the bathroom or from dry mouth waking me up. So it's a combination of the two.
Yeah. And Dan, on that, so that's, I was going to ask that. That answers one of my questions of, is it really what's waking you up? And it sounds like it's, a combination. It's, one or the other, or maybe both. But what would,
combination or both at the same time?
Right. But how would you describe the impact of that? I mean, when you wake up in the morning, do you feel, fatigued? How does that, how does that affect you throughout the day? What would you say that impact on sleep and having to get up so much is having on your the rest of your life?
I take a lot of naps. I'm a napper. Like and when I say a lot, at least one a day, which kind of offsets the interrupted sleep that I had the night before. But really, when I look at this in the scope, in the whole scheme of things, what I survived, this is pretty easy to deal with what I was facing as someone that had cancer. It's definitely a little bit of a struggle, but I'm certainly very grateful to be here today to talk.
Yeah, thank you, Dan, so much for sharing that and helping us understand those impacts. So I'm told that we were able to get Ellen connected, so really do want to hear from her. So we're going to go to Ellen here again from California. Ellen, are you with us?
I am.
Welcome. Would love to hear what you wanted to share about the impacts of xerostomia that you're living with.
Thank you. Yes, I had HPV cancer, head and neck cancer, 6 years ago. Was treated with surgery, chemo, and radiation. And as a result of my experience, my xerostomia seems to manifest itself on the day-to-day basis in terms of taste. Most, as similar to one of your other speakers, most foods taste extremely offensive to me. I can't handle anything cold. Everything must be hot. I can eat no spice whatsoever, including salt or pepper. Of course, nothing dry, no bread, no nothing. But for me, I haven't had fruit in 6 years. My diet is extremely limited. I hold a public position in my community, and my work requires me to speak in public often and to appear and meetings such as you're having very frequently. I'm on the local school board. And I'm in a leadership position in other facets of my community. So being in public and my social life has always been extremely important to me. So of course, there's no more socializing to the extent I did. Eating out, as many have indicated, is very tricky. I do it, but it's tricky. There are certainly restaurants, as another speaker indicated. I don't go to restaurants serving spicy food, things like that. I try to order off the kids' menu when they'll let me, because those items are generally less spicy. So the dry mouth, similar to others, I have water with me at all times. I don't have the trouble sleeping that some have indicated, so I'm very grateful for that. And I just want to say this is the first time in 6 years I feel as though I'm among my own kind. So I very much appreciate this opportunity.
Yeah, well, Ellen, we really appreciate your sharing and being part of this community and this discussion. I'd like to ask you a question, if I might. When you're talking about, it's difficult to go out, eat in social settings at restaurants. It's hard to find foods that you can tolerate. You've primarily been talking about, difficulty, being able to handle certain tastes, particularly spice. Do you also, is that accompanied by difficulty with chewing or swallowing, or is it really primarily the taste that is impacting your eating?
Well, I've learned to eat things, mostly not eat things that will impact swallowing, but certainly something too. I rarely eat meat because it seems hard for me to swallow. I will say as an aside that my hobby all of my adult life has been cooking. So that's also been, I still cook a lot. I enjoy cooking for other people, but I have to have tasters around me to let me know if things are spiced appropriately, things like that.
Sure.
But the swallowing, I'm very careful about. I worry about that a lot, as many have. My doctor has informed me that, swallowing, that's a big problem, especially as I age. That's something I'll have to be very careful about. So that is a fear, as with many, that I'll suffer a choking episode and maybe die.
Right. And Ellen, to that point about maybe things getting worse or progressing in the future. Have you noticed any changes in these symptoms, looking back, the past, weeks, months, years?
They have not improved.
Yes.
And for me, I try different foods. I'll experiment with things, and I've had no luck so far finding additional things I can eat. I have about 6 or 8 things that I eat, and that's it.
Right.
So, no, the xerostomia actually has increased over time. It has gotten a little bit worse. Not a lot worse, but a little bit worse.
Sure. Well, Ellen, thank you again so much for joining us, and I'm sure the other listeners today feel the same way that you do from having gotten to hear from you as well. I see we have another caller. We have Pam from Arizona who also wants to share some of the impacts of xerostomia that she's living with. Pam, are you with us?
I am.
Welcome.
Thank you. I wanted to just start by letting you know that I'm a nurse, and I had a family history of goiters, and I had one myself. My GP was really good about monitoring my thyroid labs and everything, and about 5 years ago, I went to him and I said, I can see it now, and I'm having trouble swallowing, especially at night. Do you think maybe I should have a consult with an endocrinologist at least to get a baseline? He goes, nope, your labs are good, everything's fine. So it didn't sit well in my gut, so I made my own appointment. Fortunately, I had a PPO insurance plan, and they found that I had 9 tumors, and 7 of the 9 had 3 kinds of cancer. I ended up having the I-131, and I had the maximum dose of 150. And I followed all the directions, the sucking on lemons, the candy, all that. And then I never completely got my taste buds back or anything. And so basically about at the 3-year mark, I noticed I kept having a lot more dental issues than usual. And now within the last year, I've lost a ton of teeth, and this is with regular dental care. My dentist outlaid a plan so to keep what teeth I do have and redo crowns and everything. The first step would be $15,000, and then to fill in with bridges and stuff, the second step would be a total of $36,000, which I'm just a working gal and I'm single. I don't have the ability to pay for any of that. So I found out that there was this guy who works with claims people through insurance, and he is saying that you can have implants if you petition your insurance correctly as a prosthetic. And I was curious to see if anyone in particular has tried that or has had success with that. I don't think I can handle false teeth. My mouth is just too dry. I work for a major insurance company from home. I'm always on the phone. I'm on meetings, and my depression has just skyrocketed. And now with my age, blood pressure contributes to the really bad dry mouth, everything. I've tried everything on the market, prescription, everything the dentist has given me. And I have to tell you, I feel like I've kind of pretty much given up. It's like, what's the point in paying all this money out when, or taking a second on my house or something to do this, and it's eventually I'm going to end up losing them all anyway. And for the people who are having trouble swallowing, I'm right there with you. I have pretty much, this is really bad, but I have pretty much resorted to a lot of milkshakes and ice creams because they satisfy my stomach, so I'm not hungry anymore. And then they also give me that burst of energy that I'm not getting from a proper diet. And then I've converted to more like protein drinks and stuff, but they just don't give me that boost like the sugar does. And I'm up 4, 5, 6 times a night, just I'm not only going to the bathroom, but having to get drinks of water. I constantly have cracked mouths and bleeding, and no matter what I do. And that's really humiliating when you're on a Zoom call, and it looks like you have, major issues or gross things going on. I'm just really frustrated. And like I said, I don't see that false teeth would ever work for me. This sounds funny, but I gag a lot. So I don't think I think that would contribute to the false teeth not working. And it's like, I don't know where else to turn. I just don't have that kind of money. And rumor has it that a full set of implants for your mouth, we're looking at like $50,000, which again, I'm back to the huge costs from my dentist quotes that they gave me. And it's like, what am I going to do? I don't have any of this kind of money.
Yeah. Well, Pam, first I want to just thank you for calling in and sharing not only, the direct impacts that xerostomia is having in terms of the dental issues, but also the impacts that's been having on, you mentioned depression and your ability to work, and the overall frustration that all of this, with really, not adequate treatment options has presented. So just want to thank you so much for sharing those perspectives with us today. So important to hear. I want to check in. I know we've been getting written comments as well on this topic of symptoms and health effects of xerostomia. Amanda, what are you seeing?
Yes, we just had Nan from Idaho write in that that she has also experienced some of these same issues with not being able to sleep through the night, effects with speech, eating and drinking, with rest. We've had, Leanne from Richmond, Virginia wrote in, this affects me on a daily basis. It affects my career as I'm a trainer and speaker and have trouble getting through a speech. So again, many folks are writing in with sharing these concerns.
Yeah, and thank you again. And just want to continue to encourage you to call in, write in. You can always call in at that number, 1-703-844-3231, or write in using that comment box under the live stream here today. I want to take us now to another polling question. Here we're still on this topic of how is xerostomia affecting you in your daily life. And so now we want to expand it. We've already started to hear about many of these things, but we want to understand how these direct symptoms and health effects are actually impacting the activities in your life. So for this polling question, we'd like for you to think about what are the specific activities of daily life that are most important to you that you are not able to do, or maybe you struggle to do as a result of your xerostomia, or if you're a caregiver, of course, answer this thinking about the person, your loved one. And again, this is an opportunity to select the top 3. So think, I know many of these may be impacts that you have, but which ones do you think of those that are most important to you are most affected with by your xerostomia? The options are A, public speaking, B, enjoying food or eating, C, going out to eat, D, participating in social engagements and events, E, participation in sports, recreational activities, or exercise, F, attending school or having a job, G, interacting with family members, H, sleeping soundly, or I, some other activity in your daily life that's important to you that you're not able to do either at all or as fully as a result of your xerostomia. And again, please select the top 3 that are most impacted. So we'll give you a few moments here to think about these response options that you have. Again, we've started to hear about a lot of these, but want to continue to explore this topic. And so what we're seeing as it stands, and again, these are percentages of responses, we're seeing the top 3 response being enjoying food or eating, followed by sleeping soundly. After that, we're seeing quite a few that are still selected by many of you as top 3, including public speaking, participating in social engagement or events, going out to eat, even participating in sports, recreational activities and exercise. We haven't heard so much about that, so would really encourage you, if you're having those experiences, to think about sharing those with us by phone or in written comments. But what's really striking is that everything here is within somebody's top 3, and even other things that aren't listed. Of course, want to encourage you to write in, call in to share some of these other experiences. So to get us started, to really building on the conversation we've been having and talking about impacts on activities in your daily life, I'd like to bring us back to our Zoom panel. And Janet, maybe you can get us started as you were thinking about that polling question, those activities in your life that are important to you that you can't do either at all or as fully, what rose to the top in your mind?
First of all, I am a Sjogren's patient, and Sjogren's is the second most common autoimmune rheumatic disease that affects 4 million people. And a hallmark symptom of most patients is xerostomia, and it really does impact our life. And I agree with the poll. I certainly marked those, and I had a hard time just picking my top 3. And I would like to address some of the social aspects of how xerostomia kind of impacts our life, because we have talked a lot about food, but having a social life and an active life, so participating in activities and engaging in social events. I used to be an avid dancer and play in some sports, would love to do community sports activities, dance a lot. I've stopped those activities because I actually can't keep my mouth moist enough to enjoy them. It becomes a different type of thing. And then after being limited in your social life, you do start falling out of your social engagements. And I think a woman spoke in a video earlier, and she used the term, I feel like a social liability. And I thought that was an interesting comment. So as a Sjogren's patient, and over the years, my dry mouth has accelerated and caused more and more problems. I have started stepping out of more and more social activities, which does bring a little bit of more of an isolation, which we've all been feeling the past year and a half. But
Janet, when you say, just because I want to, before you get too far ahead, I want to ask about something you just said, which was your dry mouth has really accelerated. What do you mean by that? How has that symptom changed? I assume you mean that it's gotten worse. What does that look like for you?
Yeah, absolutely. I used to be able to just sip on water and have that take care of things, have water always with my meals. But over the years, the dryness has become much more problematic, more dry. So an increase of thrush, an increase of yeast infections, an increase of cracking, greater issues with choking, greater pain, which leads to a reduction in activities, a reduction in food choices. Dental work, it's almost like with the progression of dry mouth and the amount of time you live with a dry mouth, you hit a tipping point with dental work, where your dentists are watching for these cavities, and you might start with, oh, here's 1, here's 2, here's 3, and then within a very short period of time, for example, watching several years ago, watching several cavities, I went from one appointment to the next appointment having the need for 13 cavities to be filled. Right. So if there is this accelerated dental issue. And then we get into what the carrier just said. Oh, okay, if things are going to accelerate, do I invest now, or do I just wait for more bad things to happen and go to the eventual implant? You do start wondering about how to keep up with your healthcare.
Yeah. So one thing that you mentioned, Janet, was that one of the symptoms you mentioned amongst many, so I see why it's been hard to select amongst these response options on the polling questions, and it's kind of a necessary evil to try to see what rises to the top. But You mentioned pain, and we haven't heard a lot about pain. How would you describe this pain? Is it like a sharp shooting pain? Is this kind of a dull, achy pain? Does it happen more when you're eating or drinking? Maybe if you can just help us understand pain a little bit more in this.
Sure. Pain changes depending on what's happening inside of your mouth. So when you have a yeast infection, you can just have pain happen without doing anything. Pain exists just like any other infection in your body. There's discomfort because something's amiss. But the way I explain pain with, for example, food choices to people is to imagine that you have paper cut your tongue 100 times and then you suck on a lemon. That is what having a dry mouth is like for us, in a very dry mouth. If we have food that has a tiny bit of acid, it is a sharp pain as if you have just put acid in a small paper cut. That's how I've experienced it.
Sure. Thank you so much, Janet. I also want to bring Barbara into the conversation here as we're thinking about what have been the greatest impacts on the activities that are most important to you in your daily life, and help us understand, which of the xerostomia-related, symptoms and health effects have been driving those or causing those impacts in your daily life.
Can you hear me?
Yes, we can hear you, Barbara.
Okay. My name is Barbara. I'm from New York, and I'm a retired surgeon. Actually, I did cancer surgery, but GI. And I'm just 6 months past completing my radiation and chemo. And I had a salivary squamous cell carcinoma of the sinus and the palate. So I had an extensive surgical procedure done, and then I had the radiation and chemo. So I'm only 6 months out of it. So my xerostomia, and I have Sjogren's for several years. So I'm used to dealing with the xerostomia. I mean, I always had gum and mints and water. After the radiation, I couldn't tolerate the mints. It was too painful. And I used to use, I forget the name of that thing, at night to sleep. You pop it in your mouth, Xylomints. After the surgery and the radiation, I couldn't put them in my mouth. It was too painful. Oh, wow. So I began looking for different things. And I have a whole host of things here. I have done the research, gone to medical, and I've used, I have to say, SPOHNC and the HNCA Foundation so much, and listened to other people that had the same situation. And some of the things I've found have really helped me, and I incorporate them into my daily routine. But my biggest thing is I was a foodie. My husband and I both love to cook. And we always, we'd go, a big date would be going to a very fancy restaurant. Oh, we haven't tried this one yet, so let's try this one. I can't do that. I don't even like food anymore. And I was a foodie. I loved it. And I lost, from the inception of the cancer, I lost 40 pounds. Wow. I went from a size 6 to a size 0. So, and right now I really hate, I don't like to eat at all. It's a chore. My prosthodontist said you have to consider it work.
Right. Yes.
And so I'm drinking the shakes, and I've invented some of my own shakes, which I think are a little bit healthier than Boost. And I have the sores in my mouth. I don't know if they're from the radiation still or they're from the Sjogren's. I don't know. But I'm on several not-for-profit boards out in the Hamptons, and there's all these events. It's the summer, and I go to them, but I don't eat all day, and all I drink is water. And everyone's passing out cocktails and champagne, and they have these lovely hors d'oeuvres. So someone can come to me with an hors d'oeuvre. Well, unless it comes with a knife and fork, I can't eat it because I still have trismus. So I can't get my mouth open, And once I can get something in, it's so dry, I can't get it down.
Yeah.
So my goal has been, my job has been research and finding out these things that work and incorporating them into my daily routine.
Yeah. Thank you so much, Barbara, for sharing that and really, putting, kind of some really sharp examples around how that's impacting your daily lives. I see that we have some callers that are on the line. I want to bring in some more voices to the conversation. We have one caller, Carrie from Michigan, who wants to share some of combined symptoms and impacts that she's had in her daily life. Carrie, are you with us?
I am.
Welcome.
Thank you. I wanted to sort of follow up on the comments that the just previous speaker, Barbara, I think,
yes,
talked about, which is having trismus and dry mouth at the same time. So trismus is the inability to open your jaw, and I have really severe trismus. It impacts my speech and obviously my ability to eat, and so does the dry mouth. But one of the complications I have is that because I can't open my mouth more than a few millimeters, if I start choking, I can't get the food back out of my mouth, which is really kind of terrifying.
Yes.
Because normally when you choke, you open your mouth and cough, and I can't really do that. Another thing is it also impacts my ability to have good dental hygiene. I went to my dentist a few weeks ago, and he said, you have to, he said I had pretty good dental hygiene for somebody with severe trismus, but he said you really have to be really ultra careful because of the impact of the xerostomia. And I had my radiation about a year ago, so I've only been living with it for about a year. And he said, it's going to get worse as time goes by in terms of the impact on your dental health. And one thing he did, which sounds silly, but it's really been very helpful, is he took a couple toothbrushes and put them on his grinding wheel and made them skinny so they fit in my mouth so I can brush my teeth a little better. So if you're having that issue, that's something that you can do. But I would just like to see more research into both xerostomia and trismus. I mean, I can find more about xerostomia than trismus. If you go on Google and look it up, there's like, oh, this is what causes it, but there's almost nothing on treatment. So the combination of conditions is really, really difficult.
Sure. And just to put some of these impacts that you've described, Carrie, into context for us, how frequently do you have an experience where, whether you're choking or maybe you're fearful that you'll choke and you need to, try to get the food out of your mouth? Is that something you experience daily, or are you able to, kind of avoid foods and have it happen less frequently than that?
I've been getting better at avoiding foods that cause it. Things that are hard to chew, like nuts or something.
Right.
I just basically don't eat because they can sort of slip down your throat and then you can't cough them out. But maybe once a week or so it happens.
Wow.
It's fairly common.
Yeah,
Not as much as it was in the past, but
sure.
It's fairly common. And I think some of that is psychological because, if you know that you're in this position, just feeling a little bit like you might be choking can make it much worse. Your anxiety goes way up.
Yeah. Well, thank you, Carrie, so much for sharing, this, really, kind of difficult set of health effects that you're experiencing. I now want to go to another phone caller that we have. We have Kathy from Chicago, has some unique kind of symptoms that she would like to share and how that's impacted her life and has been actually isolating. So, Kathy, are you with us?
I am. Can you all hear me?
I can. Welcome.
Thank you. Thank you for having me. And I just wanted to say to everybody, thank you for sharing your stories. This issue is so isolating. You think you're the only person in the world who has it. and no one can possibly understand it unless you go through it yourself. I'm 7 years out from my cancer diagnosis. I didn't have external beam radiation. I had to drink radioactive iodine. I had the horse's dose. And a few months later, all of my salivary glands completely failed. I've had all the CTs and cytograms and MRIs, and I have no functioning salivary gland tissue at all. So what I do now is I can only eat very bland, very soft food. I might as well be like an 85-year-old. So I'm very limited as to what I can eat, and I don't take in any salt at all, but I drink a ton of water like the rest of you. I drink it all day, and I have Xylomelts in my mouth 24/7. And I was diagnosed with hyponatremia. I'd been feeling dizzy and nauseous and lethargic. And I went to the doctor, and a normal sodium level starts at about 134, and I was down around 112. So I have to be very careful to keep salt in my diet somehow. Sometimes I just throw salt in my oatmeal. I mean, I just don't even care. Like a lot of you say, eating is now a chore. It's something that has to be done to stay alive. But I was just wondering if any of you have that experience from drinking so much water and not being able to take in a lot of salty or spicy food items that might give you some salt content. The other thing is, since I'm 7 years out, and I thought, well, it can't get any worse, can it? In the past year, I've developed burning mouth syndrome, where it comes and it goes, but when it's here, it's awful, and it feels like I've eaten 7 jalapeno peppers. And no matter how much water I drink, I can't. It's like my mouth is on fire. And I don't know if this has happened to anybody else, but I've been to my usual round of, endocrinologists, dental oncologists, and they all say, there's nothing I can give you for that. There's just nothing I can give you for that. Just drink ice water.
And how often,
So,
Kathy, do you experience that burning mouth sensation? Is this something you live with daily now, or is this come and go?
It's very odd because I'll have it every day for about 4 days until I'm ready to, jump off the roof. And then it'll go away and it won't come back for 2 weeks. So I just think since I had so much radioactive iodine, I think my mouth was still irradiated.
Right.
Because I also have the cracked lips. I have the tongue fissures, like the doctor was showing on his slide. I have all of that. And like the lady said before, I was always a stickler for my teeth. My teeth were very healthy. And the first thing that my dentist said to me after I told him about my diagnosis was, you're going to lose all your teeth.
Yeah.
And I just thought, oh my God. So my first job is making myself eat every day. And then my second job is water flossing, rinsing with a fluoride rinse, popping in Xylomelts. So it basically has taken over my life. And it also has destroyed my social life because I turn down any invitation that involves eating in front of people because I don't want any questions, because if they ask the questions about why I can't eat things or if I start to choke, then I have to tell my cancer story.
Right.
And I don't want to tell my cancer story. So it's just basically just taken me out of my life.
Wow. And is it that?
And that's it.
Well, that's a lot there. So that's it is quite a bit. But no, and that's really important to share. And it sounds like not having to explain what's going on. That tying back to your cancer story, is that what is most making you feel isolated, or is it also some of these having to eat a very specific diet and trying to get ahead of some of those nutrition issues that you mentioned? Is it that also just trying to understand from you, because you one of the very first things you said was that this is so very isolating. Just want to know what you view as the things that are making you feel so isolated.
The things that make me feel isolated are, and again, you're right about one of the guests had mentioned before that all of her friends try to be so helpful and say, well, we'll have this soft food or that soft food that you can eat. But for me, if it has tomato juice in it or it has garlic or it has anything that has even a little bit of acid or spice, and I will be on fire, my eyes will water, and I'll suffer for days. So it's just not worth it. And people really want to be helpful, but they don't understand. I didn't understand. My doctor never told me this could be a side effect.
Right.
So I never once thought in my life, gee, what would it be like to have no spit?
Right.
Never thought about it. Never. Until it happened. And then you realize, oh my God, I mean, it affects everything. Like they said, the sleeping, the eating, but I can't explain it because I might start to cry. I don't want people feeling sorry for me.
Yeah.
I'm a private person.
Yes. No, and that's totally.
So, and people will ask you questions about food too. Like they won't ask me about the scar on my neck. People are too polite for that, but people have no problem saying, "Why aren't you eating?"
Right. Yeah.
You know, or why don't you eat this kind of food, or why don't you eat that kind of food?
Yeah. Well,
so,
Kathy,
anyway.
I mean, this has been incredibly helpful to hear what it is that you're living through, and you know, the whole goal for this meeting is, you know, to understand these impacts so we can hopefully, you know, see a pipeline of therapies that might be able to help, but we need to know what needs to be addressed. And so, you know, thank you so much for sharing those things in your life, you know, that are, you know, making it, you know, feel so isolated, but hopefully today you feel the sense of community that has come together to share about xerostomia. So thank you again. I want to take us to one more polling question that we have to kind of round out our topic for today, this first session on what it is to live with xerostomia. And, you know, again, as with many of these topics, you know, we've been hearing, they're so interrelated that we've been hearing about them a bit already. So please pull out your phone, go to that browser, open that tab again, go to pollev.com/xerostomia. And the question that we have for you at this point is we want to know what worries you the most about you or your loved one's condition in the future. And again, we want you to select the top 3. So the options here are A, the stress of not knowing how xerostomia will progress, B, increased difficulties eating, C, difficulties with communication, D, choking, E, not having the energy to work and live as I want to, F, not knowing if I can support myself or my family financially, G, losing family and or social connections, or H, memory issues related to sleep deprivation, or I, some other worry that you have for yourself or your loved one living with xerostomia as a result of this condition. While you're thinking about this, I want to check in with Amanda. You know, what have we been seeing in terms of, you know, impacts on activities? You know, we've heard a lot of different things. You know, what is standing out, either something common or maybe something we haven't heard yet?
Sure. So we have heard from a lot of people who have underscored many of what our panelists talked about. I'll share a few of the people that have sent in comments. Helen from Skokie, Illinois says, my worst moments are in the middle of the night when my lips feel crusty and my throat is dry. I have learned that my nightstand water bottle is my first friend as I gaze at the clock, which usually reads between 2 and 3 a.m. So I think that comment speaks to both the dry mouth, middle of the night, the lack of sleep, which we know is so fundamental to well-being. And Louise from New Jersey says, I can barely carry a conversation without coughing, and I can't enjoy my favorite foods because of the burning sensation they cause. And most importantly, this has affected my enjoyment of eating. And finally, I'll share what Donna wrote in from Orlando. I live alone. I'm self-conscious about speech, drooling, eating. It's very frustrating for any social engagement. I can't eat in front of others with the coughing, clearing my throat, and sometimes choking.
Yeah, thank you, Amanda, and thank you to all of you who have been writing in. We'll continue to share those written comments throughout today, but know that even if we don't get to read yours live, we will be using all of your comments to include them in that Voice of the Patient report, that summary report from today. So coming back to this polling question that we have asked you to answer on what are your worries for the future, well, it looks like, and again, these are percentages of responses, we're seeing the top of the top 3 worries is increased difficulties eating, and so we're talking about worries for the future, so increase in the difficulty that we've already heard so much about. We also are seeing that there's a worry about the stress of not knowing how it will progress, so the uncertainty itself being a big worry. And then another top of these top 3 being actually choking. However, again, we're seeing across the board here, these are all of the options listed are in many people's top 3 greatest worries, including some other things that weren't listed here. And so as we're going into this final part of this first session on living with xerostomia, we want to encourage you to also bring into the discussion any worries that you might have for the future. As you were thinking through this polling question, what was it that you selected and why? I know we actually have a caller who wants to share some of her fears for the future. We have Kathy from Virginia. Kathy, are you with us?
Yes, I am. Thank you, James.
Welcome.
Like Janet and also Barbara mentioned, my dry mouth is a result of the autoimmune disease Sjogren's. And with Sjogren's, life is just hard enough dealing with all of the repercussions of little saliva, as so many people in this meeting have described so well. But Sjogren's not only causes salivary dysfunction, it also damages my salivary glands. So my dry mouth is getting progressively worse over time. That means that I live every day with the fear of what my future is going to look like. So not only with all of my symptoms getting worse, but I'm slowly losing my teeth to chipping, to cracking, to caries. And I'm not a good candidate for dentures with dry mouth. And dental implants also come with complications that are exacerbated by dry mouth. So this xerostomia just affects every aspect of my life: social, work, family, sleep, and my ability to eat certain foods and eat and swallow it all. And eating used to just be such a fun part of life. Yeah. So I am starting to lose hope that my quality of life can get better, that there will be solutions out there for me as my dry mouth gets worse and I have no saliva in the future. And I think it was another Kathy who expressed that no one really understands what it's like to live with this. Dry mouth doesn't sound so bad, but it is awful to live with it, and it just affects so many aspects of our lives.
Yeah, and Kathy, I'm hearing you loud and clear about some of your concerns for the future. I'm wondering if they're informed by any progression or worsening that you've already experienced, whether it's worsening of dry mouth, increased dental issues. Has this already been, these things becoming more severe, or has it been relatively stable for you, and this is just a worry that you have for the future?
It's something that has progressively gotten worse. I was diagnosed with Sjogren's 30 years ago, and I had difficulties with dry mouth when I was diagnosed, but nothing like I have today. And so just imagining how much worse it's gotten over 30 years, and I can only imagine how much worse if I'm feeling the social repercussions now. They're just going to get so much worse over time unless we get some solutions or just some help for this.
Yeah. Well, thank you so much, Kathy, for sharing. I think this is, we're all working towards that same goal of hopefully avoiding and overcoming the challenges you have today, but also avoiding these worries you have in the future. I see that we also have a caller, Redora from Jacksonville, Florida, who wants to share some experiences of living with xerostomia. Perhaps you could weigh in on some of your worries for the future. Redora, are you with us?
Yes.
Welcome.
Thank you for having me, and thank you for having this conference. It's very informative, and as everyone has said, I'm also a nurse and a thyroid cancer survivor.
Yes.
And in 2010, and with that also, to add to the xerostomia is I have a left vocal cord paralysis. So that's my other issue with the swallowing. You have to be careful. And my main take on this is that education, patient education. I mean, it has never been told, or I was never informed, about xerostomia before the radioactive iodine treatments that I got.
Right.
I mean, yes, they'll say you might have it, but after 3 radioactive iodine treatments, now I'm talking to you, I can't speak, hold on.
No worries.
Yeah, that's the thing. I mean, with everybody has different symptoms and different stages of where they are in their health. And yes, with the dental issues and the effects on family and financial, that's a very big effect. Like I think Ellen mentioned it about the dental implants, how it's going to cost, the extra dental work, and even the prescription toothpaste that my dentist has prescribed is not covered by insurance, so you have to pay it out of pocket,
So, Redora,
those are the things.
When you mentioned,
Sorry.
yeah, you were told you might have xerostomia, but you feel like you weren't really, there's not enough education. What symptom or health effect did you have that you would say was most surprising or most unexpected to you, or maybe, the degree to which you would have that symptom or health effect of something that you've experienced?
The degree of dryness, that chapped mouth in the middle of the night, I think it was Ellen who said at 2 in the morning, you have to just get up and sip your water and get some sips of water in there in between, every couple of hours of sleep. The dryness is just, even with the xylem milk, and it's just like not, there's much, and hopefully there'll be more treatment options that, like Dr. Scuba said, hopefully that aquaporin effect will be available soon, and,
Right. Well,
that would help much of,
Yeah. Well, Redora, thank you so much for sharing on this. So important to help advance towards that goal. I see we also have another caller, Scott from Cleveland, Ohio. Also, is, like many, has a number of different symptoms to share, and would love to hear also from Scott what might be your greatest worries for the future. Scott, are you with us?
Yes, I am. Can you hear me?
I can. Welcome.
Thank you. Some of my concerns for the future, I'm a head and neck cancer survivor and have had 2 bouts with cancer on either side of my mouth, one replacing half of my jaw with my fibula from my leg, and the other was on the upper part of my mouth, taking a few teeth and digging into the bone some. My future, I worry about the time it takes to eat. I don't know if anyone's mentioned that when you eat daily and you're a normal person, we know how it can take a lot more time to prepare a meal than to eat it. And you sit down and people are done in 10 minutes, 15 minutes tops.
Right.
And I could sit there for 45 easily. It takes more time to chew food, more time to eat.
Right.
And therefore, when I feel that I've satisfied hunger, I stop eating. I'm bored of it. I'm done with it. This has not changed in 10 years. and it's making it so that I don't quite get enough calories. So an issue is to keep my weight up and to actually gain some weight. Another future issue is I have trouble with mucus. Not having as much saliva means that you're not thinning down and constantly flushing mucus out, and so I tend to accumulate mucus, and there's like a clearing out period every morning after sleeping for 7-8 hours, and that's always kind of a pain in the butt.
Yeah, and Scott, so you said that's a worry. Are you worried that will get worse and worse in a way that maybe it's unmanageable, or what is your worry related to that?
I'm worried because in time, I know that my esophagus has narrowed some, and I guess there's a procedure where they can put a balloon in and inflate it and kind of stretch it out. It hasn't come to that yet, but yeah, I'm worried that it will get worse.
Yeah.
Right now, my go-to is water and Tylenol gum with xylitol.
Right.
I find anything else is more temporary and doesn't last long enough. I haven't tried anything prescription-wise, though, only over the counter.
Yeah. Well, Scott, thank you so much for calling in and sharing both these impacts and these worries. I see that we're getting a number of written comments coming in, so I want to make sure we cover some of those. Amanda, what are you seeing?
Sure. So most of the comments around fears of the future have been around worsening dental health, cavities, and fear of choking. Susan from Las Vegas writes in, if I were unable to talk in the future, I worry that my caretakers would not know about my condition and no one would provide me with the moisture I need for my parched lips, mouth, and throat. And there were several concerns similar with that one day conditions that are tolerable now or being managed now might become life-threatening with age.
Sure. Thank you, Amanda, and thank you to Susan and everyone that's been writing in with those comments. I see that we have a caller, Anjali from Fresco, California, has some of the symptoms that we've been talking about, but would love to hear, Anjali, about these symptoms and what about these maybe are you worried about in the future? So Anjali, are you with us?
Hi, yes, thanks for putting me up in the queue.
Yes, welcome.
Can you hear me?
I can.
Yeah, okay. Great. I appreciate the opportunity to provide some feedback. I'm a thyroid cancer patient and I'm in Fresno, California. And I have been dealing with it for 16.5 years, still trying to get rid of it. And with regards to xerostomia, the dry mouth is significant because of the radioactive iodine treatment that is given to patients. So that was the cause of my dry mouth initially, and has gotten progressively worse. Over the years, I've lost a lot of broken teeth and had an extraction just last year of one tooth that they couldn't save. But I also have vocal cord paralysis due to the thyroidectomy surgery and neck dissection, and so that creates a situation where the vocal folds don't close properly over the trachea as the food goes down the bottom pipe. And then when you're having choking from dry mouth issues, it exacerbates the issue. And we've had numerous opportunities for our son to practice his Heimlich maneuver for scouting. So he's aced that in the first aid category. And so it's good having a resident Eagle Scout, but it's terrifying when you are going through that. And I worry about being home alone and choking and trying to figure out ways that I can navigate that.
So sorry. I just was, as you were saying that, was really, it's such a understandable worry to have, and knowing that your son, has already had to do the Heimlich maneuver and help you when you were having a choking episode already multiple times. I just had to ask, how frequently do you have issues where you think you're on the verge of choking, or you actually do have that choking episode? How frequently does that occur?
It's almost monthly, sometimes even more frequently than that, regardless of how small my food is cut up. It happens.
Do you notice anything that makes it more or less likely, or is it really just unpredictable?
It's a little unpredictable because I've got the two things working against it. But oftentimes, if it's something that's stuck, it's because it hasn't properly been, cut up because of my teeth having the dental issues due to dry mouth, due to xerostomia, and so
you can see how these are all these issues are
problematic. Yeah,
interrelated.
Mm-hmm.
So,
and I think too. Right, and I think if you're having GI issues and you're told to go on the brat diet, and you have dry toast, for instance, oh boy, that's a terrifying prospect. Right. Which is, just a couple weeks ago, I had an episode of that, and my husband had to, use the Heimlich to get it all out because it was like glue.
Right.
And I think those concerns of being alone and trying to find a way to manage that, and having the phone handy and being able to know, okay, 911, and hopefully they'll get here. But
totally understand that. That daily worry, really. Well, Anjali, thank you so much for calling in. Thank you to everyone that wrote in. I want to thank all of our Zoom panelists here. This wraps up our first session of the day, which is really on understanding the experiences of the symptoms and health impacts on daily life of xerostomia. We're going to come back after a break and build on this discussion. We're going to expand it to really understanding the different approaches to treatment that you all use to help either treat or even just make living with xerostomia a little bit easier, as well as look to see what your preferences are from future treatments. So we'll hope you'll join us back here. We're going to take a 30-minute break, although I will say, knowing that having heard so loud and clear that eating can take quite a longer time for those of you, please come back, rejoin the program, and continue to eat your lunch with us today. Our first thing when we come back will be a series of panelists, so you'll have actually more than just that time to finish your lunches. So thank you everybody for all of the input today, this morning, and we'll talk to you shortly. hello, good afternoon, and welcome back to the externally led patient-focused drug development meeting on xerostomia. Again, I'm James Valentine. I'm here with Amanda Hollinger, and we are your co-moderators for today. We are about to go into our second topic of the day, where we're going to be hearing from you, individuals living with xerostomia and direct caregivers and care partners of people living with xerostomia, to now understand the various current approaches to treatment that you use, as well as understand what your preferences and priorities are for future treatments. This builds on the terrific discussion we had this morning, where we learned what it is to live with xerostomia, the symptoms and impacts on daily life. So if we can pull up our discussion questions for this session. During this session, we're going to be asking you to help us understand what are the different things that you're currently doing to manage your or your loved one's xerostomia symptoms. We heard a sampling of some things this morning, but we really want to dive more deeply into this topic. When we talk about the things that you're doing, sometimes we'll call these treatments. We really want to cast a wide net and not only talk about medicines or drug treatments that you might be using for your xerostomia symptoms, but also other approaches. It might be medical procedures, it might be more holistic approaches, maybe speech therapy, maybe even things that you have to do or change in your daily life, like diets or use of lubricants. And so all of this was within the scope of what we want to hear about. As we understand those things that you've used, or maybe things you've used in the past, we're going to want to understand how well those things treat the most significant symptoms of xerostomia, the things that you told us about this morning. In addition to understanding how well they work or maybe don't work, we also want to know what are the most significant downsides to those things. No treatment comes without some trade-offs. For drugs, that could be a side effect, but it could also just be the burden of needing to undergo or a certain treatment or strategy. And finally, we're going to conclude this session this afternoon looking towards the future and thinking about, short of a complete cure or a complete resolution of your xerostomia, what specific things would you look for in an ideal future treatment? Another way to think about this is, if you were considering a new treatment, what factors would be important for you in deciding whether to take that treatment? And so to help us get started in exploring this topic on current and future treatment approaches, we have a panel of your peers who will be sharing some of their experiences and perspectives. We have Ed, Dave, Jamie, Thad, and Jeff who will be doing this. Ed, why don't you take it away?
Hello from the Front Range of Colorado. My name's Ed King, and I was diagnosed with squamous cell non-HPV head and neck cancer in 2014. I had two surgeries, one on the tip of my tongue and the other on my neck, leaving me with a pirate scar from ear to ear. Following the surgeries, I went through 2 months of daily radiation and a weekly injection of a radiation enhancer. I almost immediately lost all my saliva. My secretions during that time were very thin, dissolved, but I was left with almost no saliva. And I began using a product called Xylomelts, which was recommended by a speech therapist at Anschutz Cancer Center at the University of Colorado Hospital in Aurora. I have found that to be particularly helpful at night. I used 2 tablets, and they helped me sleep for about 4 hours. However, it takes about an hour for them to coat the inside of my mouth, and during that time I take small sips of water to prevent myself from coughing. I don't want to interrupt my wife's sleep. A year after my treatment, I went through 40 dives in the hyperbaric chamber for bone necrosis and tissue rescission on my lower left jaw. However, the hyperbaric treatment did not affect my salivary glands. I also tried acupuncture, but that was no help either. My routines have changed very little over the past 6 years. I take a daily nap, which was recommended by my endocrinologist. And originally I used raw thyme honey, which helped coat the inside of my mouth. but after some stomach irritations, I went back to using 1 tablet of Xylomelts, which allowed me to sleep for about 4 hours. During the daytime, I continuously take small sips of liquid, which prevents choking, which can be quite violent. I wear a medical notification bracelet which says, if found awake and choking, give small sips of water. The most significant downside of drinking constantly is the negative effect on your oral hygiene. And I spend about an hour a day trying to keep up with that. The other risk, which I have actually experienced, is the flushing of my electrolytes. And now I know how someone can die from drinking too much water. The first time it happened to me, I was driving, and it felt like the tires on the right side of my car had actually gone flat, and I had trouble staying in the lane. Fortunately, I was close to home. I began drinking electrolytes to help balance this, and originally kept them in my car and at my office. Over the 6 years, I have learned to better set up my water consumption so I don't have these problems. Because of these experiences, I volunteered for a phase 1 study at the National Institutes of Health conducted by the Institute of Dental and Cranial Research. Although COVID slowed this down, the phase 1 study has resumed. It will last for a total of 6 years, with the first 6 months, including the dosing. I will be, or have been, injected with a gene carried into my salivary glands by a man-made virus. Because the dosing will only include one of my salivary glands, I won't achieve full recovery, and I will still have xerostomia. If phase 1 is successful, they will go to a phase 2 program with the hope of being able to help head and neck cancer survivors and also women with Sjogren's syndrome. My work life is flexible, so all of these issues have not affected it much, and I have adjusted my daily routine to meet these needs. I did end up giving up my favorite sport, scuba diving. I hope this was helpful, and thank you for watching and listening.
Hi, my name is Dave, and I'm from Plymouth, Minnesota. My roller coaster relationship with an evil character called Xerostomia began on February 1st, 2017. My ENT performed a neck dissection to remove cancerous lymph nodes from under my left jaw. It turned out to be squamous cell carcinoma that originated in my left tonsil. 2 weeks after a tonsillectomy, I started 7 weeks of chemo and radiation. In my initial visit with my oncologist, she explained the first 3 to 4 weeks will be relatively easy, but the last 3 to 4 weeks will bring many changes, one being my saliva. It would be very thick and sticky, it would be hard to cough it up, and very difficult to swallow. I would also find out what a mucus plug looks like. She was right, and it was nasty. I finished my last radiation treatment on April 27th. Then the real battle began. Over the next 4 years, I would try many things to help with xerostomia, all with temporary relief and many giving little to no help. A few were prescription pharmaceuticals, lots of over-the-counter products, and a couple of holistic remedies. My doctor said to drink lots of water, not only for hydration, but also I would need it to help with swallowing. Over the next 6 months, most of my calories came from Ensure. The pain from radiation was a major factor, but the xerostomia made it very difficult to swallow solid food. They said try biotin mouth rinse. It was specifically for dry mouth, so maybe it would help. It did give me minty breath, but no help swallowing food. There were a few prescription medications I could try to help increase saliva. I think the first one was pilocarpine. One of the side effects was an increased heart rate. I thought to myself, not a problem. I can handle that. After a few days, my heart was racing like a speeding train. My hands were shaking, and I could not sleep. No, thank you. I stopped taking that immediately. A few months later, a guy in my SPOHNC support group told us about a medication his doctor gave him called cevenylene. He did notice an increase in the moisture in his mouth, but the saliva was more like water. In other words, not as slippery as it was before. I tried it for a few months, but all it did for me was to make me sweat profusely. In the meantime, my wife brought home biotin gel. It too was temporary, but the best thing I'd tried so far to get a little moisture in my mouth. Over the next year or so, I tried many over-the-counter products that people in my support group told me about, including mouth coat, lemon drops, spry mouth spray, and Xylamelts, just to name a few, but I kept coming back to biotin gel and lots of water. A dentist that volunteers with our support group said there was a company coming out with an oil-based spray for xerostomia. It was supposed to last much longer than water-based products. It did require a prescription, which wasn't covered by my insurance, but I gave it a try. You could tell there was oil in the spray, but the effects lasted minutes, not hours. I could buy 5 tubes of biotin gel for every bottle of spray, so I stopped taking that. By now it was well into 2019, and I was reading an article in the SPOHNC newsletter about an acupuncture procedure developed by a former radiation oncologist who is also a head and neck cancer survivor. The treatment required 2 sessions over 2 days. There were quite a few of his patients that had a noticeable increase in saliva output, some that had been suffering as long as 15 years. I never tried acupuncture, but would do anything to get a little spit in my mouth. After weeks of calling around, I found an acupuncturist who attended a seminar put on by the doctor in the newsletter, and her office was only 10 minutes from my house. It had to be fate, I told myself. Soon I would be drooling over a half-pound cheeseburger and fries. After the procedure was complete, I did not notice anything different, but my acupuncturist said it may take a while with some people. I was not one of them. Oh well, things could be worse. At least I was alive and my cancer was gone. I have my water, biotin gel, and my best friend when eating solid foods, Alfredo sauce. Oh, don't forget the ice cream. Fast forward to the present time. I've learned over the last 4 years that the human body is amazing at adapting to change. I guess I've learned how to live with xerostomia and do what is necessary to get through each day, one day at a time. Hopefully, the input from actual patients will help in developing a treatment that can somehow activate the saliva glands, or a product that at least gets close to the properties of saliva. I'm cautiously optimistic that one day I will be drooling over that half-pound cheeseburger and fries, or at least be able to eat without choking or drinking a half-gallon of water to wash it down.
My name is Jamie Powell. I'm 37 years old from Orange County, California. In March of 2020, I was diagnosed with stage 3 tongue cancer. I've never smoked. I had no risk factors associated with this cancer. I was shocked and devastated that my voice could possibly be taken away from me and I wouldn't be able to talk or sound the same to my kids. On March 23, 2020, I had a partial glossectomy surgery to remove 1/3 of my tongue, and tissue from my leg was used to rebuild my tongue. I also had a neck dissection to remove lymph nodes. Following surgery, I underwent 30 rounds of radiation therapy. I'm a little over a year since my surgery, but my healing has been slow, and side effects from radiation have made day-to-day tasks very difficult. There were many side effects of radiation rambled off to me at my treatment consultation. Prior to radiation, I had my wisdom teeth removed so my jaw would not completely fall apart during treatment. I was in no mood to listen to all the side effects of radiation. I was in so much pain already, I just wanted to start and be done. The one side effect that kept coming up along with lifelong was dry mouth. I thought to myself, well, that's better than dying, so I casually said, yes, I understand. By casually, I mean, let's just start and get this over with already. Radiation was extremely hard on me. I seem to have gotten every single side effect, and early on as well. Within the first week of treatment, the burns started to show, followed by mouth sores, blisters on my neck, trouble swallowing, the swelling of my jaw, loss of taste and not being able to speak, and dry mouth. Because I am so fair-skinned, the burns were excruciating. My throat and mouth could have been confused for Freddy Krueger's face. And dry mouth was completely unmanageable. After finishing treatment, I was still in pain and still struggling to eat and talk. I had to relearn how to speak after surgery, and now I had to do it again after radiation. The sores and burns in my mouth subsided in 2 months, but my dry mouth was very much here for the party. Xerostomia is like that bad party guest that just makes you cringe. They show up uninvited, and it's all you can focus on. Many suggestions were made to help with symptoms of xerostomia. Suggestions were drink water frequently, use Xylomelts at bedtime, humidifier to moisten the air, brush after every meal, floss after every meal, chew sugarless gum, eat soft foods, avoid caffeine, use a spray bottle to moisten mouth. I carry water with me everywhere. I can't talk more than 3 minutes without having a sip of water. I go through 2 gallons of water a day, and at night 73 ounces. This took some time to have my body get used to this much water. I often felt full from so much water intake, and I didn't want to eat. I lost even more weight, which concerned my doctors, and talks of a feeding tube were in the works. I have 2 humidifiers running at night and a diffuser. This is to help moisten the air at night, which worked for a little bit, but not long term. My giant jug of water is propped right next to me because during the night, my dry mouth is so bad, I wake up multiple times choking and need water right away. I sleep sitting up, so I have a nice nook to prop my jug of water up right next to me. It's very uncomfortable. I go about an hour and a half at night before I need to drink water. My sleeping is terrible because of this. Waking up every hour and a half to take a drink does not make for a restful night. I tried the Xylomelts, and since my salivary glands are dead, they were awful. They did not stick. They just stuck to my dry gums, and they did not dissolve. They sat there all night. One time I started to choke on one. Nope. This was not a solution to a long-term problem. I looked elsewhere and asked my doctors, and they were surprised when they came up short. They recommended all the things I had previously tried and then said, well, you knew this was going to be a side effect. I've learned to live with xerostomia, but since this is a common side effect of head and neck radiation, I would love to see something that can be taken before radiation to help minimize the side effect. I think this would help tremendously in the long term, having xerostomia be a minor inconvenience rather than the main star of the show.
Hello, my name is Thad and I live in Charlottesville, Virginia. I was diagnosed with oropharyngeal cancer, a squamous cell carcinoma, in April of 2019. I started my radiation and chemotherapy treatments in late May of that year and completed the 35 radiation treatments in mid-July. The side effects were numerous and in some cases severe. Radiation sores in my throat and esophagus, complete loss of taste, tinnitus, and of course, xerostomia. My body and spirit have healed in many ways, but unfortunately my salivary function is still impaired and likely always will be. The xerostomia affects many facets of my life, but eating is definitely the most prominent. I'm a powerlifter and I need a lot of calories, usually 3,500 to 4,000 a day. I'd estimate I consume more than half that in liquids, smoothies, protein shakes, and protein drinks, primarily because eating in volume is difficult for me. Even if I'm eating something that's easier to get down, like meats or things in sauce, my saliva production generally can't keep up, and my mouth dries out before I'm actually full. You won't be surprised to learn I am a champion-level customer at Smoothie King. Sleeping is also challenging, as my mouth dries out and I wake up unable to swallow several times each night. I keep a squirt bottle beside my bed at all times. I also speak at industry events, usually for an hour or more, and maintaining moisture in my mouth during that time is a huge challenge. Having a decent amount of water or tea on hand is a lesson I learned the hard way. I do have difficulty swallowing, but I believe that's because there is scar tissue on the flap that closes over my airway. I have fluids go down the wrong way at least once a day, and coughing them out gets a little tiring. I wasn't even aware that loss of taste was categorized as a xerostomia symptom, but apparently it is, and I definitely suffer from that. My taste was completely gone by the end of treatment, aside from everything tasting like battery acid. Some pieces came back, salty, sour, and some bitter. My umami is decent, so I can taste some savory. Sweet is definitely the taste that forgot to come back. So desserts don't have that much appeal for me anymore, and fruits are often sour when they shouldn't be. I've tried a wide array of treatments. Aside from just staying really well hydrated, I've used sprays, lozenges, bitters before eating to bump salivary production, chewing gum, and even facial massage. The sprays were generally xylitol based and just require a couple spritzes directly under your tongue and then swishing it around in your mouth. I've generally found them to be useful right before a meal, as they seem to help saliva production and promote swallowing for 15 to 30 minutes after you use them. The lozenges were a slippery elm-based product, specifically designed to combat dry mouth and increase saliva production. I sometimes use them when I have speaking engagements or for very long meetings. They're also very good for travel, since they're easy to pack and water on travel can often be limited. My herbalist recommended using bitters before meals, just a couple drops in some water, drink it before eating, and the bitterness spurs your body to produce extra saliva. This hasn't had a noticeable effect for me, but maybe it works for other patients. As my saliva production has decreased somewhat over time, an oral radiologist suggested I use self-facial massage to increase blood flow, hoping to keep those tissues healthier. This is a longer-term strategy to maintain what saliva I do have, so the benefits are going to be over time, and it's hard to say exactly how much it has helped. In the end, all these treatments have provided a brief but temporary solution, and I have yet to find something that allows me to eat sticky or dry items like mochi, ciabatta, brownies, or oatmeal. Even with the day-to-day difficulties, of course, the treatment was worth it. Surviving is really the only success metric here, and all survivors know that is going to come at a cost. That said, I would be very interested in any new treatments to lessen or eliminate xerostomia. Gels, sprays, pills, shots, I'm willing to try just about anything. I did see a gene therapy trial which sounded a little scary, primarily because I didn't fully understand what they would be manipulating and what the potential outcomes would be. But the xerostomia has enough of an impact on my day-to-day life that I would be willing to take some risks if that meant the impact might be lessened.
I'm Jeff, a 10-year survivor of stage 4 HPV head and neck cancer. The diagnosis happened when I was 56. One of the major daily side effects of radiation has been dry mouth. The lack of saliva drastically alters the taste of what you eat, sometimes in a good way, sometimes in a bad way. It's very hard for me to tell the cause of pain when I'm eating. Is it the temperature of the food or the spices in the food? So the herb thyme now tastes like the all-purpose cleaner Spick and Span smells. So I have to ask if that is in the food. Over the past 10 years, I've tried many methods of increasing saliva or decreasing dry mouth issues. Obviously, I'm still coping with these. I use different mouth rinses and homebrew concoctions like honey, olive oil, almond milk, vegetable oil, lemon and herbal teas, sucking on mineral stones, using humidifiers, acupuncture, lymphedema, massage, neck massage, and homeopathy. A few of these methods provided some relief, and saliva has increased a bit. Oils, honey, milk, and teas provide temporary relief, but it's difficult to have them on you all the time. A humidifier does help give you some relief when sleeping, but it does nothing to increase the saliva. No noticeable saliva was noticed during for neck massage or lymphedema, but the neck massage definitely decreased pain and spasms. I still have some swallowing and aspiration issues at times, but technique shown to me from a swallow test helped minimize those. I can also say acupuncture definitely helped in increasing saliva about 10%, in eliminating tongue numbness about 95%. Homeopathy did help in getting better sleep as well. I had a serious memory issue, which was caused by the lack of sleep pattern due to a painful, dry mouth waking me up every 2 to 3 hours. As a working musician, drummer, performing live gigs and session work, I experienced the inability to recall how a song started or the name of a song to the beat. These are not good problems to have on a live gig. I had to find a solution, and I'm very grateful that these alternative methods work so well. One of the items I have never heard anyone else talk about is how dry mouth affects hearing. I lost a major amount of hearing due to the chemotherapy of cisplatin, only after 1 dose. Since then, I'm in a constant battle with drying out the eustachian tubes, which then causes clogging from the sinus drainage, and my hearing becomes muffled like I'm underwater. Again, this is not good for a musician. I use a neti pot or nasal rinse, but that doesn't always work. The odd good thing is that I do find some moisture relief from the sinus drainage, so it's kind of a bittersweet scenario. Current dry mouth treatments and remedies like biotin mouthwash and spray and spray and gel are very helpful getting through the day. These work well when out and about, and I'm always looking for ways to feel normal again. Another hopeful approach is the use of immunotherapy. I was fortunate to have had immunotherapy treatment to address my metastatic head and neck cancer, and I'm here because of it. If this can be used instead of radiation as a first-line treatment, that would be a dry mouth game changer. My wife and I have gained new respect towards resourcefulness. We never stop looking for alternatives, we never stop asking questions, and we never accept unreasonable answers. Thanks for your time.
Thank you, Jeff, and thank you all of our panelists who shared their journeys of trying different treatments over time, sharing things that maybe have helped, maybe they helped for a while and then no longer helped as much, but those things that also did provide some relief and helping us understand that, as well as sharing what you're looking for in the future. We'd like to, at this point, broaden the conversation to all of you in our live audience, all of our individuals living with xerostomia, any of your direct caregivers or care partners that are out there in the audience too. You're welcome to call in and write in. As a reminder, the number to dial in to join the conversation is 1-703-844-3231. Again, that's 1-703-844-3231. Call in at any time during the session to share your experiences with current treatment approaches, and towards the end, we'll look towards the future. Also, if you want to write in with comments, you can always write in using that comment box under the live stream today. To get all of us thinking about these issues on different approaches to treatment, we're going to start with a few polling questions. So like before, for everybody that's been with us this morning, you can pull out your phones, open up a browser, go to pollev.com/xerostomia, or you can open a new tab in your browser and do the same. This is for all of our individuals living with xerostomia and their direct caregivers. We would like to hear from you on what medications or medical treatments have you used. And here, please select all that apply. I'll note that polling is focused on medical treatments and medications. We'll ask you in our next polling question about some non-medical treatment approaches. So the options here, we have A for antifungal medications, B for pilocarpine, we have C, cevimeline, D, natural dry mouth relief, E, lozenges, F for antibiotics, G for saliva substitutes and moisturizers, H for prescription fluoride, I, counseling or therapy, J for antidepressants or anti-anxiety medications, K, some other medication that's not listed here, L for any clinical trial, anyone's been enrolled in a clinical trial for a potential treatment, or M, you have not used medications or medical treatments recently to help with your xerostomia. And again, we'll be focusing on non-medical treatment approaches or non-medication treatment approaches in the next polling question. As a reminder for our audience, when these questions where the audience has a chance to pick more than one response option, the percentages we're seeing are not the percentage of people selecting that option, but the percentage of overall responses. So again, please treat these bars as kind of relative rankings based off of how large they are. So we'll give you a few moments here to think about these response options and let us know which of these have you or your loved one used to help with your xerostomia. And as you're going down that list and you're clicking off each of these different treatment options, be thinking about, was this something that helped me? If it did, how did I notice? Does it continue to be helpful, or did its helpfulness wane after some period of time? Also be thinking about, has these treatment approaches, did they have any downsides? Were there any side effects or burdens associated with them? And did that result in you stopping the treatment, or do you continue to experience those things? That's what the kinds of things we'd like to hear about as we move into this discussion. As it stands, it looks like the most common medical treatment approach used by our audience today is saliva substitutes and moisturizers, followed by lozenges and prescription fluoride. But we see a lot of other treatment approaches that have been tried. Actually, we see antifungal medication as another maybe top treatment approach, but everything here has been used, including some other things that aren't listed. So we'd love to hear about that, as well as some of you have been in clinical trials. So we'd love to hear about your experiences. Very few have mentioned that they've used no medical treatments recently. If we go to our second polling question. So as promised here, we're expanding, and now we're looking at some treatment approaches beyond medications and treatments. And so here we'd like to know, what are you currently doing to help manage your xerostomia symptoms? Again, select all that apply. The options here are A, gum or hard candy, B, avoiding sugary or acidic foods, C, avoiding alcohol or tobacco, D, drinking water, E, glycerin swabs, F, stress management, G, acupuncture, H, air humidifier, I, dietary supplements, J, increased nonverbal communication, maybe writing more notes or using text messages more frequently, K, enrolled in a clinical trial for some non-medical treatment approach, or L, some other, something that's not listed on this slide or the last polling question, something else that you've tried that we haven't listed so far. And then M, if you're not doing anything, including these non-medical approaches to help manage your xerostomia symptoms. And again, please select all that apply. Okay, so as it stands, it looks, and we heard this resoundingly this morning, I think, too, but this confirms it, that drinking water is perhaps by and large, the most common treatment approach, non-medical treatment approach. That is followed by use of gum and hard candy, avoiding certain foods, and avoiding alcohol and tobacco, as well as use of humidifier. Although we see a lot of other treatment approaches selected, pretty much everything except for glycerin swabs, and nobody has reported that they're not doing anything. There's no treatment approach to help to try and manage their symptoms. One final polling question we'll do at this point. So here we want you to think about all of those things, medical treatments and medicines, as well as the non-medical treatments. We want to know how well does that total current regimen that you have control your xerostomia. The options here are A, not at all, B, very little, C, somewhat, D, to a great extent, or E, if you were someone that's not using any treatment approaches of any sort, please select E. And again, as you're thinking about answering this question, as you're looking at the options, the gradations here, what is it that came to mind that made you, pick very little instead of somewhat, or a great extent instead of, another option? It's really, that you're calling in and sharing your experiences that will really help us understand, how well current treatment options are working for you. So while final responses are trickling in, it looks like the greatest response is that the current treatment regimen is helping somewhat, with a little over half of our audience today reporting that. About a third are saying it helps only very little, and then about 10% say to a great extent. No one reports that current treatment regimen provides no help, and there's nobody reporting that they're not using any treatment approach again. So with that, now let's have a discussion about some of these issues that you just answered polling questions about. And I'd like to welcome our Zoom panel today, who's going to start us off in helping think through this. Before we go there, I just want to remind you, you can call in at 1-703-844-3231, or you can write into that comment box under the live stream to share your answers. But Katie, I was wondering if you could get us started here in thinking through, the different treatment approaches and how well they work. Is there something that stands out to you as maybe being most helpful?
Hi there. Thanks for having me today. I'm Katie from New York, and I'm a Sjogren's patient. I produce and market live events, concerts, attractions, Broadway shows, etc. So I have a very hectic professional life, which can often be in direct combat with my disease and my body. For those that don't know, Sjogren's is the second most common autoimmune rheumatic disease affecting 4 million people, with dry mouth, xerostomia being prevalent to most. So this is something that I have to plan for daily. So to answer your question, what works best for me, I didn't even know at the beginning that I had dry mouth when I was looking at what made up Sjogren's, and doctors were talking to me because I didn't know any better, right? And I had been coughing for 2 years, and I was choking in my sleep, and a light bulb went off, right? When I was presenting and talking like this, I had no voice in my professional or personal life. And so that's how I was diagnosed. So I would say immediately something called a Voxec, which is also known as Cevimeline, is a pill, had helped me, but with a lot of side effects, right? Sweating, weight gain, tiredness, dizziness, don't drive a car when you take it. I mean, I literally passed out at the office the first week that I was on it. It did help with the choking, and that no longer happens, but it's not good enough. I don't think it's effective enough. I'm 5 years into my journey now, and I'm noticing my symptoms are progressing, and the coughing's coming back, which you'll probably see during this. Like people in the poll said, I am constantly drinking water. What that means, though, is that you always have to plan, right? I always have to plan during my daily life or meetings or Zooms. Yeah. And it makes sleep, and overnight I wake up an unusual number of times because of it. So I am more hopeful for more systemic solution. I hope that answered your question.
Yes, it did. But I do want to probe with you a little bit. When you mentioned that you got relief from coughing and choking, can you maybe tell us what did that look like for you before you went on treatment? And you said it really completely resolved. What do you mean? I mean, was it that just mean no actual choking, but there was still coughing? What really did that look like?
I would say that it's was moderately resolved, right? So
Okay.
the choking where I was grasping for air stopped. But this is also in conjunction, besides having to take 3 cevimeline pills a day, I take 2 Neurontin pills a day to help with like the spastic coughing and also nerve pain. And on top of that, I get Rituxan infusions every 6 months for 2 weeks, 1 week and then 2 weeks later, and then 1 week and 2 weeks later, that are about 5.5 hours long. Because my Sjogren's affected my lungs. So on top of the dry mouth, I have interstitial lung disease. So you can imagine these things working together.
Yes.
I had a lot going on here. So I'm no longer, to answer your question, no longer choking in my sleep, but I do lose my voice for talking after talking for a while. And the cough is something that I always have to deal with.
Yeah, and one last question for you, Katie. When you said that the coughing is starting to come back, how did you notice that? How did you notice a recurrence?
Yeah, it's so ironic with the timing of this, wonderful panel and day, because I noticed it recently. I don't know if it was some kind of post-COVID thing combined together. My doctors are trying to figure this all out. I have to be honest, it's been about a year since my Rituxan infusions, just because of safety and concern and all of that. And so I don't know if the coughing is because of my levels, because I need to get my infusions, as I like to get fueled up. So I'm not sure, but it did affect me. It has affected me to the point where I was presenting at a meeting at work the other day, and I literally stopped talking. There was nothing coming out. So it has driven me to make appointments with all my doctors, ENT, pulmonologists, and rheumatologists. I find when they work together as a team, I get the best and most swift information.
Yeah, thank you so much, Katie. Maybe to add to this, Scott, as you were thinking about the treatments, was there one when you picked it that you thought, yes, that this has been the most useful thing to me, or maybe it's a constellation of things together, but would love to get your input on what maybe has been most useful.
Hello, my name's Scott. I'm from Cleveland, Ohio. I've had head and neck cancer that showed up 10 years ago. And then about 5 years ago, another recurrence on the other side of my mouth. The radiation was what did the made the lack of saliva with me, I'm sure. Some has actually come back, not worsened, but I still have a problem with it. Water is my go-to. Gum with xylitol, Tylenol, Trident is another go-to. I found that having water on hand while eating helps a lot, because the duration of time that it takes to eat has made it so that I have a hard time getting enough calories and keeping my weight up. It turns out after a certain amount of time, if my hunger is satisfied, then I'm done. And it may not be, there's still food on my plate. Right. Going out to eat is affected because of that. But taking water every sip, I haven't found anything to be more effective. If there was some medication that was time released and maybe helped with mucus as well, I tend to get a lot of clearing out in the morning because of a night's sleep. It turns out saliva waters down mucus constantly and clears it out with a normal person, where someone without saliva can have a problem with that. And that's been an ongoing problem.
Yeah, so Scott, so I can really appreciate this. You've got some tools that help very acutely, like only really in the instant. That particularly makes sense from water, having water to drink. Can you maybe describe the gum and how the gum helps you, beyond what water provides?
The gum helps because Trident keeps its taste for a fairly long time.
Yeah.
And I think evidently I don't need that much taste with a piece of gum to keep it in my mouth. So time is the factor there. It lasts longer, and I can have a piece of gum in my mouth or put a new piece in, and it can be hours of relief that will help with regards to speaking. If I have to go somewhere, if I have to be part of a meeting, I'm not chewing it now, but I have my water handy.
Yes.
Yeah, I find that it definitely helps as an ongoing treatment, even when not talking, just driving, just doing my daily chores or what I do daily, having gum in my mouth to keep from getting dry helps a lot.
Sure, sure. And you know, to that end, you know, I mean, how frequently are you know, chewing on gum versus, you know, sipping on water throughout the day? I mean, you mentioned you could chew on a piece of gum for hours. That is pretty amazing. So, you know, what do you, how would you kind of talk about what a normal day for you looks like in terms of that regimen?
Currently, because I this summer had 2 surgeries for pre-cancer, one which came back suspicious with pathology after the surgery, so they went in again and took more of the back of my tongue. Because of that, chewing gum has been put on hold. When both are used, I would say that they're used for different reasons. Water is with me all the time, even when I'm chewing gum. It's in the car, it's where I go. I take it from the car with me when I get to my destination. So water would be the primary, and the gum with xylitol, an additional helpful tool.
Right. Yeah. Well, Scott, thank you so much. This has been so informative to really understand these treatment approaches that you have available. I see we have a caller. We have Ronnie from Oklahoma who wants to share some approaches to treatment, kind of adding on to what we've been talking about. So, Ronnie, are you with us?
Yes, I am. Thank you. I appreciate you letting me speak.
Yeah, well, thank you. Welcome.
I'm an 8-time oral head and neck cancer, squamous cell carcinoma survivor. I've had 11 surgeries. My cancer started in 2003. My last one was, we finished up in January of 19. So I've been battling xerostomia for a very long time. I have found things that work. A little bit, but not everything works for very long. One of the things we went through was trying creams and olive oil and those kind of things, and they helped for a little while, but I don't know if everybody else experiences it, but once I had the dry mouth, my mouth is so sensitive that I think Biotin's a great product, but I don't know how to get the manufacturers to take away the mint or the citrus. Anything with mint or citrus is very disagreeable with my mouth situation.
Right.
So I really can't use that. I did find a product. It was called MedActive, but that company has gone out of business. And that really caused me a lot of problems because that one was really helping me and working for me. They had a product that was a natural spring without any citrus, so it didn't burn my mouth and was very helpful.
Okay.
So I've resorted to here lately. Lozenges are great, but because of all the surgeries I've had, choking is a big factor. And I don't want to get too graphic, but sinus drainage coming from your sinuses and then hitting your dry mouth is a big choking hazard for me.
Wow.
If I happen to aspirate something, coughing something from my lungs to my mouth, it's a big problem. So I get choked both ways. And the choking is a big thing. That's the only thing that I have thought over my 8 cancers and everything I've been through that might kill me was the choking. To be honest with you, I'm very fearful of the choking.
Yes.
So I have resorted to lozenges, but the lozenges, because I have very little feeling left in my mouth, they get lost and I choke on them.
Wow.
My solution to that is to soak the lozenges in some warm water until they dissolve, and I've emptied out a debilitating spray bottle and added my concoction to the spray bottle, and right now that seems to be helping me a great deal.
And Ronnie, when you say, when you describe it as helping you, what does that mean? Does it mean your mouth just it stays from more moist for a longer period of time? Does it help you speak or eat? What does that look like for you?
Yes, I'm on my second feeding tube. I have no teeth left. I have only the right lower jawbone. The left is gone. So I still try to eat, not eat really, but drink small sips of shakes and water and milk because I want to keep those muscles working. I have hope in the future for technology to help with this problem and maybe get me back to having some teeth and being able to eat. So this concoction that I have bringed up seems to keep my mouth moist. I'm also a motivational speaker. I go and speak at conferences about my cancer and how to get through things and the dangers of tobacco. And so, of course, the more I speak, the drier my mouth gets.
Of course.
And the dissolved lozenges seem to keep my mouth and my throat moist for longer periods of time and allows me to do those things and go and speak because I love that. I enjoy giving back.
Yes. Well, and
those kind of things. Go ahead.
I was just gonna say, and you're really giving back today too. This has been incredibly, helpful. Hearing this, kind of saga of kind of trial and error till you get something that's right for you. So really want to thank you for sharing, Ronnie. I see we have another phone caller. I want to bring in another voice to share some of her treatment experiences. We have Susan from Las Vegas. Susan, are you with us?
Yes, I'm here.
Welcome.
Can you hear me?
I can.
Hi. Okay, my name is Susan. I live in Las Vegas. My situation's slightly different, but I'll run through it. I had thyroid cancer. They removed half of my thyroid, found cancer on the other side, went back in, took that side out. After that, I had radioactive iodine. One doctor said to use 50, 131, one said to use 100, and one said to use 150. The nuclear medicine doctor did 150 because he said, I don't want to see you back here. About 2 weeks later, I started having a burning mouth situation. My mouth felt like I drank a cup of coffee, and the pain never went away. It burned the coffee pain never went away. It burned my whole mouth, and it stayed there all the time. I went to my maxillofacial surgeon who had treated me for some TMJ problems years ago.
Yes.
This all happened about 12 years ago. Anyway, he said, I am not going to treat your situation until you get checked out by a cardiologist because sometimes mouth pain can be heart problems. He sent me to a cardiologist. I ended up needed a stent put in and basically saved my life by having that stent put in.
Yes.
After that, I went back to him. He must have tried 20 different drugs from gabapentin to Lyrica, and it goes on and on and on.
Okay.
Finally, we tried a combination of drugs that are off-label drugs. They're more seizure-related type drugs. So I combine Lamictal and Klonopin together, a very high dose. And that seems to help the burning mouth, not the dry mouth at night, but the burning mouth, it helps. I won't say it takes it all away, but I can function. I was ready to pull my hair out. I couldn't stand the pain.
When you say that now you can function, what's an example of something now that relief has enabled you to do, or what your daily life look like that's different?
Well, I was home a lot. I'm a real estate broker. I was home a lot. just in pain. Every single thing I did, I couldn't eat certain foods. Everything I did hurt me. There was nothing I could do to get that pain to relieve itself. Now, I take these drugs 3 times a day, and I can kind of tell the pain gets worse if I forget the midday dosage. You know, and I run in and I take it, and it alleviates the pain somewhat. Like I said, not totally, but at least it helps. So I know it's a weird combination of drugs, and you can't just stop it, but it might help some people.
Right. Well, Susan, thank you so much for sharing that. It's, you know, however unusual the treatment approach, everything is on the table today. We want to hear about it, so thank you again. I see we have written comments coming in as well, lots of treatment success stories, so we want to make sure we capture some of those. Amanda?
Sure, James. So a few things that people have written in about that we haven't discussed yet but may get to are acupuncture as helpful, taping lips shut to keep mouth breathing to a minimum. Let's see, Salogen 3 times a day, baking soda and water, a product called Helios, and Dave writes in from Plymouth, Minnesota, sleeping has always been an issue because of dryness. I was diagnosed with sleep apnea after my treatment, so now use a CPAP. It makes a huge difference in the moisture in my mouth.
Yeah, thank you, Dave, and to all of those of you that are writing in. We're seeing those comments, and we will be including them in the Voice of the Patient report, the summary report that will go to the FDA. So I want to broaden the discussion a bit, and in addition to talking about, we've mostly been focused on how well treatments might be working. We want to broaden this to also talk about, you know, maybe some of the negative consequences of your xerostomia treatments. So we're going to go to a polling question to think about this. So go ahead and pull your phones back out, open that browser, go to that other tab if you're following along on your computer. And here we want to ask you, what are the biggest drawbacks of your current treatment approaches? So thinking about all of those different things that you've tried or you have recently tried, select the 3 things that you view as their biggest drawbacks. The options here are A, those treatments are not very effective. B, there's a high cost or copay, or they're not covered by your insurance. C, there's limited availability or accessibility of those treatments. D, they come with side effects. E, they require too much effort or too much of a time commitment. F, there's some other drawback to those treatments that we don't have listed here. Or G, this question is not applicable because you're not currently using any treatments or they have no drawbacks. So again, please select the top 3 of the biggest drawbacks to you. And as a reminder, these are the percentages of total responses. So this is a kind of ranking we're seeing play out on the slide in front of us. So we'll give you all a few more moments here to get your responses into this polling question. As it stands, it looks like the leader of the pack is that, you know, treatment approaches just are not very effective. You know, so we want to hear really what that means to you. You know, we've heard some about what's helped. We certainly, you know that there's at least some relief that you're getting. But when you say it's not very effective, what do you mean? We want to hear what those gaps are. You know, we're seeing across the board, you know, all of these different drawbacks being selected as top 3. It looks like maybe, you know, in second we have high cost or not a lack of insurance coverage. We're seeing side effects. Really would like to hear, you know, what those side effects are. You know, what are the treatments you're trying? What is that resulting in? And, you know, I think about this broadly, not just, you know, a side effect of a medicine, but, you know, what are the, you know, we heard a little bit about side effects of having to drink so much water earlier. So think, you know, more broadly there. But again, we're seeing everything really here showing up as a top 3, including other things. So please call in, write in with those other drawbacks as well. As a reminder, you can call in. That number is 1-703-844-3231. Again, that's 1-703-844-3231. But to help us thinking about treatment drawbacks, I want to come back to our Zoom panel here. And start with Hal. As you were looking at that polling question, what stood out to you? What is the biggest drawback or limitation of existing therapies from your perspective?
I am Hal. I'm from New York. I'm a head and neck cancer patient. I was diagnosed in October. I had surgery in November to remove a squamous cell carcinoma from my tongue. It was HPV. It was an HPV virus. I had chemo and radiation treatments January through March. After 33 radiation treatments, of course, I lost my sense of taste and saliva. I was lucky enough to get most of my senses of taste back. One of the things that I haven't heard much about is I've been to my primary care physician, my oncologist, my dentist. Nobody really has, in my doctors, nobody's really recommended something. They all seem mystified. Like, oh, I've heard about this, but I've heard it doesn't work. So,
right.
I was told to use biotin. Biotin has a very limited usefulness for me. It helps for minutes and then goes away. Of course, I drink a lot of water. That helps me a great deal, and I keep it by me all the time. I found this product. I've heard a number of people mention Xylomelts. Surprisingly, they've helped quite a bit. At night, sleeping, I'd wake up in the morning and couldn't speak. My mouth was like stone. Everything was beyond dry, my sore throat. I started using the Xylomelts, and amazingly, I wake up lubricated. I don't want to say moist, but I don't have the sore throat. This has been an amazing product for me for that's very, very low in cost.
So Hal, do you use it every night then? Is that like a nightly routine for you?
Yeah, so I started about 10 days ago when I found it. And I actually forgot to use it 2 nights ago. And I woke up at 4 o'clock in the morning, and I was like, it was like I couldn't speak. My throat was sore, everything. Right. So I put it in, and they're a unique product because they kind of stick to your gums or whatever. By the time I woke up, I was fine. So I will now tell you that that's the only thing that's worked for me to this point. My biggest challenge from coming back from this head and neck cancer is the dry mouth and not being able to eat. I was always considered a foodie. I would eat so much food and, so many places that, my friends are looking at me now like, I don't get it. Who are you?
Right.
I don't want to say I'm eating to live because I'm actually doing better than a lot of the people I've heard. But it's really hard. Like I can't eat chicken. I can't eat bread. I tried to eat a chocolate chip cookie. That was within a second. It turns to stone in my mouth. It's just such a hard thing. And I wish there were something to make that easier. There's one more product I did try. It's actually a very expensive, it's called Vutia. And it's a cell phone sized thing that was created by a dentist who was a head and neck cancer patient. You can find it online, Vutia. And I bought this machine. And basically what it does is it's got a microfilament that goes into your mouth and stays there. And you're supposed to be using it 24 hours a day. You carry the unit on like a cell phone, and then there's a bottle of water beside it. And you set the speed of which you want it to lubricate you. And it basically replaces saliva. So this does work. It's a good system. But in my lifestyle, I find it cumbersome to have to wear that whole contraption on my waist all the time. And I roll so much at night that using it in my sleep, because they give you equipment. It's a fascinating thing that does work. But
and it's water that it provides or something else?
Water. Yeah, you're just putting in potable water, and honestly, it does work. But for me, there's limited times I can use it. And also I talk during the day. I run a company, and, managing where that microfilament is, you don't really see it. People who've watched me like, wow, I can't even see it. It's on your ear, but and I'm bald, so that you can see the earpiece, but
right.
You can't see the thing going into my mouth.
Yeah.
So I do recommend it, but for me, it's got limited success only because of how many times a day I could really rely on it.
Yeah.
So that, I'm just shocked that there's not more, and that my doctors have not said, hey, try this, try that. Right. I'm going to try humidifiers after hearing everybody's conversation today. And, that's an easy fix. And, I'm also going to try acupuncture, which a couple of people have recommended couldn't hurt. So again, I'm struggling less than most. I've come back from this better than I would have expected, but certainly not where I need to be. I have almost no saliva, and I'm hoping that over the next year or two, I get some back.
Yeah, thank you so much, Hal. I want to bring Kathy into this discussion too. Kathy, we're, thinking about, yes, there's things that help, but what are the biggest downsides or burdens related to treatments that you've tried?
The biggest challenge for me, and first I'll say I'm Kathy, I'm calling from Virginia, and I also have Sjogren's, which Sjogren's can affect any body organ or system, but really always affects the moisture producing glands and leads to dry mouth or xerostomia.
Mm-hmm.
So one of the biggest challenges for me for every single thing I have tried is that the solutions are short term. They're not long lasting. So, it seems like a first go-to for all of us is to sip on water. Right. Well, that lasts in my mouth maybe 45 seconds. And then the 3 times I have to go to the bathroom afterwards and take the time to do that just creates a major burden. Also, water washes away some of those good protective elements that saliva has. Like Dr. Shuba mentioned this morning, he said, yeah, it's mostly water, but that few percentage points of what saliva is made up of, it's mineralizing agents that help protect our teeth and protect the mucosa or the lining of our mouth. Lozenges are short-lived too. They last a little bit longer than water, and you have to have some moisture in your mouth to be able to chew gum or to be able to suck on a lozenge.
Right.
So I also have to sip water every once in a while I have a lozenge, just so it just doesn't sit there and harden and get dry in my mouth. Then there's side effects. I've tried both pilocarpine or the Salogen and the cevimeline or the Evazac. And there are side effects to both of them. And again, they last maybe an hour to an hour and a half. So they do help some, I'm grateful, but not long lasting.
And what are those side effects, just so we know?
Primarily, I just drew a blank, but primarily the cevimeline causes me to sweat more, Salogen especially. There are some neurological side effects. I can really feel it. And one of the things that I think hasn't been raised at all today that just struck me is the fact that all of us face a grieving process. It's having saliva is one of the things that makes us human. It helps us to function in the world and to be a part of the world. And, you're not always aware of it, but you grieve for that loss. And I remember the first time I tried Salogen first because that came on the market first. And the first time I took it, then I had this sticky kind of mucosa that Scott mentioned.
Right.
And it took it a while to really kind of get flowing. And I had mixed feelings about it. One, I was like, oh, good, maybe this will help. So I was thrilled. But the other side of me was like, it was reminding me of my loss and reminding me that Salogen or the cevimeline are not going to be lifelong solutions. They're not going to help me forever. So it put me into this real depression. It was like I didn't want to be reminded of the fact that I didn't have saliva because on some levels I had learned to adjust to living without it, as horrible as it was. You just get used to those awful aspects in your life.
Yeah. Well, Kathy, thank you so much for sharing that and sharing, the mental health kind of piece to that. I saw lots of nodding heads. Katie, you were one of those. Is there anything on kind of the emotional, mental health kind of side of things that you've experienced that, is kind of a unmet need that exists for you?
Yes, I would just co-sign everything that Kathy said for sure. I think one of the first things, I always said, especially with Sjogren's and not even realizing what dry mouth was at first and all these terrible things that were happening to me, the time it takes to get diagnosed, it takes forever. Now the Sjogren's Foundation has shortened that window in the last several years with all of their work, but it's still a fight for patients, and especially while doctors, I believe Hal was even, speaking of something, either people don't know about it or they don't know what to give you, or everybody's different because it's affecting different organs, right? But with all of us sort of sharing this dry mouth thing. And honestly, for me, I think the first time that I was at a social event with family and I literally could not speak. I'm clearly an outgoing person. I talk a lot. This is what I do for my job. And it was traumatic for me to sort of have to learn my new normal. So for a while, I think that's, just what I said. I had to figure out my new normal. And once I figured that out, I was able to sort of proceed in my day-to-day life. But grief is certainly part of it. And no matter what gets you to this point, I think that's something we would all agree with.
Yeah, thank you so much, Katie. So we have some callers who want to share some of their treatment experiences as well. We have Cheryl, somewhere close by, Washington, D.C. area. So Cheryl, are you with us?
Can you hear me?
I can. Welcome.
Is it working?
Yes.
Hello. Okay. Yes. I've had experience with some of the things that people have talked about so far. I have a very dramatic dry mouth. It turns into paste. I have to scrape it off my teeth every time I eat. I take practically every kind of medication that was given to me. Initially, they start with the biotines. Unfortunately, I happen to have a reaction to the principal, the xylitol. It gives me gastrointestinal problems.
Okay.
So after that, I went through a number of other medications that I took. I took natural treatments also. I took ginger. I have all kinds of little products I kept taking. I think there's toothpaste. I end up with machinery I was looking for. And there are two things that one person already mentioned, which is this machine that they have on the market that puts water in your mouth.
Right.
I think it's Lucia is the name of it. And it's a very nice machine. The thing is that, of course, the design is rather fragile. It's very hard to keep it in your body. Discreet, but it's not terribly well formed, so that sometimes the water goes off. And also, if you happen to have a CPAP, which I have to have, it can drown you at night. You have to be very careful about putting water in your mouth at night, even if it's controlled. And the second thing I tried was called a Sally pen, which I got from Israel. It was a stimulator for the muscles and the saliva glands in your mouth.
Right.
Of course, I have very severe tori, so I couldn't actually put it in. These kinds of gadgets theoretically are helpful, but they don't really work with people like me because, unfortunately, my dry mouth is provoked by, initially it was provoked by use of antidepressants because I had a reaction to anesthesia after a dumb kneecap surgery 4 years ago. And that produced traumatic dry mouth. So dry mouth, so I had to scrape all this goop out of my mouth. The antidepressants caused more dry mouth, and it was once it was installed, it did not go away. And then I got off of that, and they put me on this. They made a diagnosis in Parkinson's, and the Parkinson's medication, unfortunately, provoked even more dry mouth.
Wow. And
it's been installed. It's not once it's there, it does not go away, and you try everything. I've tried these mechanical things. I thought that, in fact, the idea of putting the saliva in your mouth. Also, a product called Saliva Max. Some people may have tried also. It's a saliva substitute that you can buy. You get a prescription for it. The problem, of course, is I'm losing my teeth because of this, and it's happened in 4 years only. My teeth are all, my gums are receding. It's really rather dramatic, the solution. I've tried practically everything. I'm speaking very rapidly, unfortunately, because I suffer from this Parkinson's syndrome.
Yes.
Which causes me to speak very quickly.
No need to apologize. This has been extremely helpful. How frequently are you picking up and trying? You've mentioned a lot of new things that you've tried over time. What does this process of trial and error look like? Are you, finding something every, few weeks, few months? Maybe if you can tell us a little bit about that, that might be helpful.
The thing is that people are those frustrated. I was very sympathetic when I heard people talking about the psychological impact of this.
Mm-hmm.
They don't work for very long.
Not long.
They work a little bit. I tend to put a little ginger in my mouth because I started eating at night because ginger makes my mouth salivate a little bit. I tend to use a little prickly pear, again, under the tongue because it helps me to salivate a tiny bit. Then it doesn't taste too bad. It doesn't have any long-lasting effects. And when you take things that don't work, it's extremely frustrating. It's very demoralizing, of course. And you keep trying, but of course, you're not going to go anywhere because there's no particular coherent strategy that you presented to you. Every time I talk to a doctor about it, I go to the doctor and say, well, have you tried biotin? You were born yesterday. I said, I tried biotin years ago.
Yes.
It's not working. I've been there, everything else I've gotten it's a terrible frustration because you know that it's going to always be there, and you think that maybe parts of these things might work together if you had sort of a comprehensive approach. Somebody could go to a specialist and say, "Here's where I come from. I've tried all these different things, and they're very expensive. I've invested in them. Maybe someone work for other people. There's no plan of a whole total package that somebody could give you a test and say, I've got natural remedies here, or I've got mechanical ones, and actually help you as a whole. There's always this sort of pot-shotting, and that's probably the most frustrating and debilitating thing. You're always pot-shotting as opposed to trying something that coherently says, oh, I've eliminated this as part of this work, and part of that works together with this particular patient. Maybe somebody could take the Vute, it would work very well for them, or they could use a saliva pen.
Yes.
With the stimulator for the glands, and then maybe use a natural remedy. But it's never combined. You sort of come to your own corner to figure it out for yourself. That's very frustrating and very demoralizing.
No, and that is very understandable, and I think that sentiment is starting to be echoed here. I think that's coming through. So Cheryl, thank you so much for sharing this and sharing just how resourceful you have to be, trying so many different things and some things that we haven't even heard about yet, like the prickly pear under the tongue. I mean, just how many different things you're trial and erroring is just, really stands out to me. I see we also have Alan from Brooklyn also wanting to share some of his experiences with some different standard OTC treatment approaches and maybe others. So I'd like to see, Alan, are you with us?
Hello. Yes.
Welcome.
I don't hear you. But
Alan, can you hear me?
Yes.
Okay.
Yes.
Well, welcome, and
Okay.
we'd love to hear about what treatments you've tried and your assessment of those.
I'm a 3-time oral head or neck cancer survivor. 28 years ago, I had radiation, 52 sessions over 14 weeks, and soon had very little saliva, a roasted mouth and throat, and had to try to imagine new ways of surviving.
Yes.
I did lose 70 pounds. And to describe everything I went through could take a long time, so I will try to be very, very brief.
Yes.
After the radiation and the dry mouth, I started losing teeth and then had to have hyperbaric oxygen treatment to have my teeth removed, then further treatment to recover from the surgery. Some of my jawbone was removed. And I became a person who wore dentures that never fit well because my lower jaw couldn't, what was left of it, couldn't hold dentures. So I'm biting impaired, chewing impaired, swallowing impaired, and speech impaired.
Yes.
I then had cancer again in 2012 and lost a third of my tongue. And that actually led to difficulties with my biggest coping tool, which was water. I couldn't easily swallow water. And then in December, I was diagnosed with ear cancer. I had my left ear canal removed, and I had radiation and chemotherapy. The thing I wanted to have a minute to focus on was that I haven't tried treatments. I wasn't aware that there were possible treatments, but what I did was learn over 28 years, for which I'm so grateful, how to adapt.
Yes.
So someone said they couldn't eat a chocolate chip cookie. Well, I would take a chocolate chip cookie and put it in a glass of milk, let it get soggy, and be happy I had that. I eat mostly soft and mushy.
Yes.
It's sad going to restaurants with friends and not being able to order, and for the most part not being able to enjoy foods I've eaten all my life. But before I go to a restaurant, I read the menu online and be sure that I've found something that I know how to eat.
Right.
There are many adaptations that I've developed over time, and I'm very happy to have heard some of those adaptations that people brought to this discussion.
Yeah. Well, Alan, thank you so much, and thank you for sharing some of yours. I think we hear you loud and clear just how creative, people living with xerostomia have to be to navigate, daily life. So really appreciate your calling in. I see we also have comments on this point of treatment downsides, treatment burdens. So Amanda, what are you seeing?
Yes, we've had several people writing in, and it really underscores the polling that was done earlier. The main treatment downside that people are writing about is the fact that most of them don't seem to work or don't seem to work for very long. Another one which has been touched on somewhat is the downside of mint flavoring. Judy from Pleasantville, New York writes, all the special toothpaste, mouthwashes, fluoride gels, and special preparations are flavored with mint, which irritates my mouth, causing my lips and the roof of my mouth to swell. And Nancy from San Diego also writes in, I cannot tolerate mint, it burns, and so many products are mint flavored.
Yeah. Thank you, Amanda. And I'm going to take this time to just remind everyone, if you'd like to call in and share your experiences, you can, of course, call in at 1-703-844-3231, as well as you can keep writing in with comments, and we'll be sharing those throughout. I want to check in with Scott on this topic of treatment downsides. What to you stands out as maybe the biggest downside burden, that you're left with given your current treatment options?
I would say that the downside would be how temporary I mentioned, I think before, that a time released product would be nice. Yeah. I think Kathy mentioned that it's all very short-lived. And then there's the trips to the bathroom. You're middle of the night waking up. If it isn't because of a dry mouth, then it's to make a trip to the bathroom because you tried to lubricate your dry mouth. Yeah, so my biggest gripe would be there's nothing that's long lasting.
Right.
It would help with the quality of life to be able to take something and go out for the night and not feel like water needs to be nearby. The man that mentioned he was in a band. In the past, I was in a band and sang, and it wasn't easy getting through even a song without wanting some water. And I definitely took a sip or two between each song. So yeah, time is the biggest problem. Yeah. The amount of time that anything seems to work.
Right. Thank you, Scott. No, thank you. That's very clear. I see we have Tammy, a caller from Riverview, Florida, who also wants to weigh in on this topic of the burdens of current treatments. Tammy, are you with us?
I am. Good afternoon.
Welcome.
I think everybody has kind of foot stomped everything I would have said. So the only thing I'll really add is the second and third order effects that come from whatever treatment plan that we're doing.
Okay.
And the consistency that has to be maintained in order to get just a small amount of relief. And when that consistency is interrupted, are you then starting over, or, can we pick back up? The relief just doesn't seem to be the same. And so, that's been really the biggest frustration, is the amount of effort and work that you have to put into it.
Right.
The return on investment is not very great. You get, you get relief, but I don't think from what I've heard from everybody, it's not the amount of relief that we would desire.
Yeah, and
I know from...
Oh, go ahead, Tammy. Please finish.
Go ahead.
So I was just going to...
I was going to say, and for me...
You go.
Go ahead.
No, you go ahead, Tammy.
I was going to say, for me specifically, so I'm a Sjogren's patient, recently diagnosed in September of 2020. However, I've had xerostomia for over a decade. That was probably actually the first thing that was diagnosed, but it was diagnosed from the standpoint of side effects from allergy medication. Like that's just a normal side effect from allergy meds. I've had, pretty much I don't have a safe tooth in my mouth, and I know I have very good hygiene. And so it just baffled everybody why every time I would go to the dentist, I would have cavities. Now it's to the point they're all just cracked. The teeth are cracked, so they're all falling out one by one because they're so weak.
Right.
Everybody talked about like the sucking on the candy and stuff. For me in particular, I can't do that because anything I suck on causes cuts in my tongue and cuts in the roof of my mouth because it's so dry. And so now you talk about the second and third order effects. Now whatever I eat is going to bother my mouth. And so what do you typically do? You want to avoid pain. So then my diet is affected, which affects the amount of energy that I have. And, I'm saying we could go down the road on this domino effect.
No, absolutely.
And so...
No, and I actually want to, I'm curious, I want to go, let's knock one more domino down. You talked about the amount of energy that this takes and, all of these efforts just to, try to handle the first order, second order, third order effects. What is that energy sink? What is that translated to in your life? I mean, are there activities that you've had to stop doing? What does that meant and looked like in your daily life, Tammy?
Oh yeah, so absolutely. So for me, where it's really critical, so I'm an endurance athlete, and I go through an insane amount of hydration, water, electrolytes, and everything because the entire time I work out, I'm just always feeling parched. Like, oh my God, my lips are sticking together because they're so, they're just dry. You got to kind of like peel them apart. And so if I go somewhere and I don't have my water, or if I forget to bring those things, then you pretty much suffer throughout the day with whatever activities you have to do. And especially now, it's not like you can just go to a water fountain and get a sip to drink. I either have to stop at a store, try to get some bottled water, or go without and pay the consequences.
Right.
The other thing is, so I'm on Invoxic, and yes, the prescription is 3 times a day, but come on, let's be for real. How many people can remember to take their medicine 3 times a day? And so
I'm seeing head nods from our Zoom panel, Tammy.
Yeah.
They're with you.
Yeah, so I struggle with a midday dose, and I struggle with the evening dose. And so again, the medication is designed to be, its efficacy is when that medication is taken in certain amounts over a certain period of time for a certain length of time. And so if you interrupt that cycle, then you're not really getting the benefits of the medication. You're not getting the stated benefits of the medication.
Yes. Well, this has been incredibly helpful, Tammy. So I appreciate you letting me probe a little bit with you. This has been really illuminating for us, and I think it's really important not to just talk about the first order issues, but what are the downsides with that come. As you said, it's a domino effect. So really appreciate that. I want to broaden the discussion. We're going to be kind of the final question of the day that we're going to pose. Of course, we still want to hear about your current and previous treatment approaches. So, please keep calling in and writing in about those. But we also want to now add to the list of topics what it is that you're looking for from future treatments. And so for our last polling question of the day, so pull your phones back out, open that browser. We want to ask you, which aspects of your condition would you rank as most important for a possible new drug or device treatment. And we want you to pick the top 3. We know this will be difficult given the wide range of impacts that you all told us so much about in our first session today, this morning, as well as really has been reiterated in hearing about your treatment approaches this afternoon. So the options that we have are A, something that increases saliva production, B, something that helps with ulcers of the tongue and the mouth, C, helping the ability to speak, D, prevent dental caries and cavities, E, improve altered taste, F, help with cracks in your lips, G, help with chewing and swallowing, H, reduce oral pain or burning, I, prevent oral candidiasis, J, prevent salivary gland infection, K, help with halitosis or bad breath, L, improving your ability to communicate verbally, M, reduce fatigue, N, help with your mood changes, things like depression or anxiety, O, something that would slow or stop kind of the overall progression of your disease, even if it didn't necessarily improve your current situation, or P, some other aspect of your condition that you would rank as most important for a possible new treatment option. And again, please pick the top 3 kind of treatment goals that you would have. We'll give you a minute to think about this. We know this is perhaps maybe the hardest question of the day. And we want to encourage you to call in, write in, and as you're thinking about this, tell us why. The why is really important. All right, we'll give you a few more moments here to let us know what your top 3 kind of treatment goals are for a possible new treatment. I think it's clear that the top choice that we're seeing is increasing saliva production. I think that probably makes sense. That's the first order issue, as we have been hearing. It was so nicely described by our caller. After that, we're seeing helping with chewing and swallowing, as well as helping prevent dental caries or cavities as the third. Those are really, I think, stand above the others as the top 3, at least from our participants today. We're also seeing, though, that almost everything else is somebody's top 3. So there are lots of things that are top priority that are not as common, perhaps. But I think that's important to keep in mind. The only things that we're not seeing are no one has selected preventing salivary gland infections, and no one said other. So finally we can maybe pat ourselves on the back. We finally maybe have a set of response options that captures the broad experience. But someone prove me wrong and go ahead and pick P. That would be great too. So let's explore this. I want to come back to our Zoom panel and ask Kathy. Kathy, if you're thinking about what are your treatment goals? What short of a complete cure, complete resolution of your xerostomia, what would success look like from a next potential treatment?
Yeah, if I couldn't have complete resolution of the dry mouth and the consequences of that, first of all, I'd want something that's long lasting, not something that's so short lived, like I think almost everybody has mentioned at some point. The second thing I would want is protection for the teeth that I have and for the lining of my mouth, the mucosal lining. I don't want to lose my teeth. And if I do lose my teeth, I want to know that there's some solutions that would work. Right. And then finally, I would want, in Sjogren's, it damages the salivary glands. How do we replace that? We no longer have healthy tissue. We have just damaged tissue that can't function, and no drug can make it function. So what can we do for that? And I know Dr. Shuba, for example, mentioned this morning the water channels, aquaporin 4, and the gene therapy. I am so hopeful for gene therapy, and I just wish we could get something on the market before I'm 100 and in time to really help me. or with systemic therapies. With a lot of the systemic therapies for Sjogren's, one of the biggest outcome measures that we always look at is salivary flow and how is it helping dry mouth. But it's a very different approach rather than just directly approaching the salivary glands. So there are some things that are that are possibly on the horizon. But I've also seen a lot of these things on the horizon for many years, and I haven't seen them come to the market yet. And we need help.
Yeah. So Kathy, let me ask you, so you kind of, you bought into my premise, if I couldn't have complete resolution, which of course is, we know that's the obvious thing that would be helpful. Yeah. So, but you still said, systemic approaches, also even maybe gene therapy approaches. So putting maybe the specifics of what those approaches might be aside, but things that might really be disease modifying, you would still find some improvements without complete resolution to be meaningful to you?
Absolutely. There's just no question. Okay. I mean, as we've all talked about all the possibilities and the things we do, from sipping water to having a humidifier to trying prickly pear and all these different things, the reason we're trying all these things is that nothing really works.
Right. Absolutely. Well, Kathy, thank you so much. That's very helpful. I see we have a phone caller that I want to bring into this conversation. We have Jan from Oregon who wanted to share some treatment approaches. But Jan, I'm going to try to get you also involved in this conversation about future treatments and maybe what you would be looking for. So I'd like to see, Jan, are you with us?
I am indeed. Thank you for taking my call. I, too, am a squamous cell carcinoma of the tonsil survivor. Okay. Radiation chemotherapy from ended treatment in 2009. And I thankfully have not had any reoccurrence. I certainly can agree with the panelists and callers. Dry mouth is a huge issue, and water is my best friend. However, my heart hurts for people who are losing weight, and I just wanted to make a suggestion. Most people are kind of getting stuck with things like Boost or Ensure, these liquid products, which are high calorie, but my experience when I was having a feeding tube was that I wanted something to crunch. I wanted something between my teeth. And there is a product out now that is high calorie. It has a crunch, and it becomes nectar thick in the mouth, so it's easy to swallow. And I just wanted to share that product with those that might be interested, and they can find it on a website called SavoreSe, SAVORESE.com, and these products are kind of a wafer, kind of a puffy cracker, so to speak. They have different flavors and easy to, like I say, it would have satisfied my tongue, so to speak, to have something to crunch on when all I had was a feeding tube. But I could have swallowed that, and I just wanted to share that with others.
No, thank you, Jan. We had not heard about that yet today, so really appreciate you sharing it. While I've got you as part of the captive audience, would you mind if I asked if you're thinking about what more would you look for beyond the treatments you have today? What might represent something that would be meaningful progress to you?
Well, it would be wonderful to have a product out there that really would keep the mouth continuously moist like you have. Yes. And I have tried biotin I found it not helpful. I did Xylomelt discs. I thought those were very helpful. They lasted me about 45 minutes. And when I was working outside the home, 45 minutes was a big deal. I could, I could talk with a moist mouth for that period of time. But I would love to have a solution to this, but, and I don't want to sound like a pessimist, but if your saliva glands are ruined, how do you resolve that? I don't know. Water, again, is my best friend. I panic without it. I was listening to Kathy say that if she left her water at home, and I'm thinking, oh my God, I could never do that.
Sure.
So other than that, I really don't. Water is my best friend, and
Sure.
I would just suggest that probably many people would agree.
Yes. Well, thank you so much, Jan. This has been really insightful. Appreciate your sharing both your current treatment approaches in that broad sense of things that just help making living with xerostomia a little easier. Those savories, kind of wafers being one of those, but also helping us think about what we still could do for you for future treatments. I want to come back to our Zoom panel and maybe ask Katie, if you're thinking about, short of that full resolution, that, maybe full cure, so to speak, what would represent a meaningful treatment for you in the future?
So not to be overly repetitive, but with my Sjogren's symptoms, obviously I align with everything that Kathy has said. On top of that, for me, my whole thing is we're talking about a group of people that have a lot of trouble swallowing and issues with their throat and saliva. So why are we taking so many pills a day just from a practical standpoint? So for me, it's more about quality of life and lifestyle. Like I actually like getting my infusions better for my other symptoms because I can plan for it in an easier manner. Right? When Tammy called in, she was talking about Avoxex, Vimiline, whichever you have, and you have to take it 8 hours apart. So you have to plan pending if I sleep in one day or if I have an early meeting, like it's not the same thing. So even if you don't forget and you're trying to plan, sometimes you can't even get that in and you are struggling by the end of the day. Right? And my dry mouth can get so bad where if I cough, then I gag and then I throw up. I don't think we even talked about that stuff, and so throwing up for me can be really something that I struggle with a lot. So for me, I would love, there are all kinds of, other diseases I've seen recently where there was one where you get 3 shots a year and it's done. I have no issue with needles. I would prefer either an infusion or a shot that was a more systemic approach. So for me, I would love to not be taking all the pills and to find a different solution. So lifestyle and quality of life are a big factor for me that I'm continually hopeful for and looking for.
Yeah, so really ease of use, more spread out kind of treatment approaches. I mean, is there a minimum amount? If it was once a day, would that be okay? Is that better than now, or would it need to be?
Of course, and I'll do whatever I have to do. I just think that more people, I just think it would be easier. I think once a day would be fine. I would have no problem, like even if it was self-inflicted shots and not somewhere else. I know some people would have an issue with that. I'd be fine with it. Sprays or, something like that. So I'm just hopeful that, between new technology and science, there's something else besides these pills.
Right. Well, thank you for that. And Scott, I've seen you nodding frequently during some of the discussions around future treatments. Is there anything you'd like to either reinforce or add to the discussion?
I agree with what she just said. I think that it was a good idea to have another option than a pill, because I'm guessing everybody has had pills go down and not complete the passage. And you have to choke them up. Sometimes they don't just come up. You have to make them come up. The size of the pill, definitely a problem. A vitamin can be a problem. And then a time release, I mentioned earlier, something that lasts longer. I wouldn't mind something that's combined with a mucus blocker, with a thinning element for mucus. I guess that's about it.
Yeah. No, that's great. And, it is, of course, so important to hear, things that are commonly desired. That's maybe things that we can put on the top of our wish list, so to speak. So I want to thank our Zoom panel so much for joining us and contributing throughout the conversation. It's been such a pleasure. We do have a phone caller that I want to go to. We have Hank from Union, Ohio, who wants to speak to some treatment approaches, and hopefully we'll be able to also weigh in on this topic of preferences around a future treatment. Hank, are you with us?
Yes, I am, James. Thank you very much for taking my call.
Of course, welcome.
In 2006, I attended a SPOHNC conference in New York, and one of the presenters was a medical doctor, radiation oncologist, whose topic was medical acupuncture for xerostomia. And I was very intrigued and really wanted to try his treatment, but having a second cancer a year later, and just the finances of traveling to D.C. and the 2 days there kind of put me back for another year. But thanks to my radiation oncologist, I had a lot of baseline before I started treatment. So I was able to find out that I had lost 85% of my saliva due to radiation and cisplatin. But after my treatments with this doctor, I was able to improve my saliva back to 75% of my baseline. And I've been able to maintain that. I now go every 3 months for a treatment every other day for 2 days. Mm-hmm. And it's helped tremendously. But I think some of the stuff that's lost in this conversation that the FDA needs to stop and think about, the xerostomia affects the whole body. It's oral systemic health. And overall, whatever happens in the oral cavity can spread into the bloodstream and trigger systemic inflammations. And it's something that we have to think about and trying to find some way to do this. Now, for me, acupuncture works. For some people, it doesn't. For everybody, it doesn't work, but for some, it will. I would just like to say that, a consideration has to be made when you're considering funding or looking at or working with companies as far as finding something that's going to be long-lasting. You've got to take into consideration that there is more than just the oral cavity that's being affected.
Yeah, and Hank, can you maybe give an example of something you've experienced that's been a more, systemic or non-oral related, health concern?
Basically, yeah, the fatigue factor we talked about earlier. You were talking about people having a problem sleeping.
Yes.
The fatigue factor comes into play because, again, your bloodstream is affected. You're not getting enough oxygen in there, so you're not able to get a good night's sleep or to be able to have the energy to get through the day. And the same thing, you're constantly having to use water to improve yourself to be able to get through the day.
Sure. Well, Hank, thank you so much. This has been so incredibly helpful and informative, and thank you for bringing us back to that. We did hear about that a lot in the morning session. It hasn't come up as frequently here in this afternoon session on treatment, so it's important to have heard that. I want to thank everyone who's called in, but before we end our session on understanding your current approaches to treatment and your desires for future treatments, I realize that we still have a number of written comments that have come in. So Amanda, I want to check in with you.
Sure, James. So just a few highlights about treatment goals for future treatments. Daria from Coffeyville, Kansas writes in, it would be ideal if there was a way to protect the saliva glands before radioactive iodine treatment. Les from Mesa, Arizona writes, an ideal treatment would be a saliva substitute that's effective and easy to use. And Mike from Ann Arbor, Michigan notes that any new treatment should address tooth decay and the ability to sleep through the night. And he also adds the ability to eat more normally would be nice as well. So those are some of the comments we've gotten.
Sure. So at this point, this concludes the part of the program where we've been hearing from you, people living with xerostomia and their direct caregivers and care partners. And I really have to just say, as your meeting co-moderator here, it's been such a tremendous day, from start to finish, learning, that really this is not just dry mouth. I don't think anyone could have really appreciated that until we heard from you what that really means all day, every day, what you're experiencing. Even it's not just difficulties with eating, those words do not mean or reflect what I heard from all of you today, which is just so much more. So you all have been so incredibly brave, and I just have to commend all of you for pulling back that curtain that sometimes we don't show to the rest of the world, to let us know what it really is to live with xerostomia, and similarly, really letting us know, where treatments work. You were very, direct in saying what worked, but then the limitations of those things that work and the downsides and what you're looking for. And so, I am confident, as someone that's been working in this field for many years now, that this input today is going to have lasting effects, not only for all of you, but really all those that have and in the future will suffer from xerostomia. Now I get the honor of introducing a speaker who's going to be providing some summary remarks. I have to say that's an impossible task to try to summarize all that we heard from you today, but I think it's important to capture some of the highlights of what was shared. That's my friend and colleague, Larry Bauer. Larry is the perfect person to attempt this impossible feat. He spent many years at the National Institutes of Health as a research nurse. He worked for 10 years at the FDA in new drug review, and he has been a partner to all of us in helping plan this and many other PFDD meetings. So without further ado, Larry, take it away.
Thank you so much, James. I really appreciate that. Like you said, I will try to summarize this incredible meeting. We've heard so much throughout the day. I apologize in advance if there's any major point that you feel that you made that I have not summarized, put into my summary, but there's a lot to cover. So just to recap the day, the meeting was opened with opening remarks from Amanda Hollinger, the co-moderator, who's the executive director of the Head and Neck Cancer Alliance. Amanda's comments were followed by opening remarks from Dr. Kendall Marcus from the FDA's Division of Dermatology and Dental Products in Cedar. Dr. Marcus shared with us that patient-focused drug development meetings, they're valuable to the FDA so that the review staff can learn from the experts. Those experts are the people living with xerostomia as well as their care partners. And this kind of input can help facilitate treatment development for new products for xerostomia. Following Dr. Marcus, we had a great clinical overview to kind of set the groundwork for the day from Dr. James Shuba from the Johns Hopkins School of Medicine. Dr. Shuba talked about salivary dysfunction. He said it can be caused by radiation therapy, by Sjogren's, as we heard, by sometimes medications cause it, and it might even be caused by growing older. People undergoing treatment for head and neck cancer have a 60 to 70% impact with grade 2 or higher xerostomia. So there's significant impacts from radiation treatment. And lack of saliva has many different impacts related to digestion, taste, speech, dental disease, and mouth infections. There's about 40,000 new cases of oral cancers in the United States with an average age of onset at 59. And millions are affected by xerostomia in our country. There's a heavy impact on quality of life, as we'll hear, as we heard from the panels, with very few effective treatment options. And he also mentioned, Dr. Shuba mentioned a couple advances in treatment, including electrical stimulation as well as gene transfer. So I'd like to recap a little bit of the two panels. Panel one focused on symptoms and what are some of the daily health impacts from xerostomia. We heard from Ron, who had a third of his tongue and lymph nodes removed, followed by radiation therapy, which all led to xerostomia. The xerostomia is persistent and causes mucus to be thick and sticky, which makes speech difficult. He described, which many others did, how nighttime is particularly bad with increased dry mouth, leading to being tired during the day from being awake all night. And Ron stated at the end that thinking xerostomia as just dry mouth is a vast underestimation of its impact. We heard from Ada, who spoke about living with post-radiation new normal. Her xerostomia is not improved at all, and it really affects what she can eat. It's also caused episodes of painful swallowing and choking. And she mentioned sleep disturbance as well. She said, I wake up several times during the night with uncomfortable and painful parched mouth. We heard from Hank from Ohio, who has had many side effects of xerostomia and developed serious mouth issues. He had multiple dental caries, which led to him having all of his teeth removed, as well as developing necrotic bone tissue in his jaw. He said not eating regular food has been a real loss for him. He states, my wife and I rarely go out to eat or socialize anymore with friends if a meal is involved. Jeff then shared that xerostomia leads to mouth infections, especially oral thrush. On his worst day, he said that his voice gets hoarse and it's hard to swallow, and he often chokes and coughs while he's eating. Sometimes he feels panic when his throat is blocked by food, which we heard from several people. He said the dysphagia aspect of xerostomia is the worst. He mentioned, as I get older, I worry about what's going to happen to me. And other people have talked about that too. You know, the symptoms don't improve over time. And then finally, our last panelist in the morning was Judy, who had a malignant neck tumor and radiation. She never anticipated the problems that would follow. She experienced serious weight loss as a result of issues related to xerostomia. She's a lover of great foods, but now she often says she eats alone. She used to do a lot of public speaking, which is now a challenge. And she said, when I speak for extended periods, the words become unclear, but I struggle to keep going. So people identified overall many problems related to eating. Food choices are very limited and they have to really plan out meal times. Many people reported intolerance to certain foods or flavors in foods. And sadly, almost everyone talked about impacts on their social life. And also, most people reported that dealing with xerostomia is a daily battle. In the afternoon, we focused more on treatments. We heard from Ed, who had extensive head and neck cancer surgery and 2 months of radiation therapy. He uses Xylomelts to try and coat the inside of his mouth, which many people said they tried. He had then 40 hyperbaric treatments to treat the bone necrosis in his jaw. He tried acupuncture, which did not really help. He spends about an hour each day on oral hygiene, and he's participating in a 3-year gene therapy study at NIH that's currently in phase 1. Next, we heard from Dave, who described an evil character named Xerostomia. He initially relied on drinking Ensure to try to get enough calories. He's tried numerous therapies, including pilocarpine, acupuncture, all with limited efficacy. He relies mostly on water, which was ubiquitous. Everybody talked about that, biotin gel, and dietary modifications. And he hopes that there eventually is a treatment that more closely mimics the properties of saliva. Next, we heard from Jamie that had stage 3 tongue cancer requiring a third of her tongue to be dissected. She has xerostomia as a result of surgery and radiation. She has no salivary function, so Xylomelts do not help her, but just stick to her gums. She has to drink large amounts of water, which affects her appetite, and then that affects weight loss. So there's kind of a cascade effect of problems. She stated, I'd love to see a treatment that works over time and makes xerostomia just a temporary issue. Thad received 35 radiation treatments for oropharyngeal cancer. Eating is, once again, his most important life impact. He tries to stay hydrated, uses lozenges, chewing gum, and massage. All the treatments, once again, only give temporary results. He said he'd be willing to participate in a clinical trial, even if there were some risks, because xerostomia has such an impact on his life. And finally, we heard from Jeff, who had stage 4 cancer at age 56. He's tried humidifiers, honey, acupuncture, lymphedema, and neck massage. He also said he uses a humidifier at night, and sometimes he uses a neti pot when the xerostomia actually dries out the eustachian tubes, which impacts his hearing. His treatments have provided some relief, but many are difficult to have around when he's not at home. He said increasing saliva production has been minimal at best. So we've consistently heard that there continues to be a great unmet medical need for people with xerostomia. About a third of the people polled today said that their biggest drawback to current treatments was that they're just not very effective. Many report that symptoms were much more than they ever anticipated when they were told that they needed surgery and radiation. All these treatments are mostly focused on ways to replace saliva and to try to moisten the oral cavity and provide some relief, but nothing seems to provide lasting improvement. And overall, people would be willing to participate in research and would like more effective treatments. So at this point, I'd like to turn the meeting back over to Amanda Hollinger from the Head and Neck Cancer Alliance. Thank you. Amanda?
Thank you, Larry, for the very helpful summary. Not an easy task with all the rich content that we were provided with today. This has really been a day of hearing personal insights to help us all better understand xerostomia and its impacts. Thank you to the FDA for giving us permission to hold this meeting, and to the staff who tuned in today. A special thanks to Shannon Cole from the Patient-Focused Drug Development Program staff of the FDA who guided us through this process. Thank you also to Dr. Kendall Marcus from the FDA for your perspective on the patient-focused drug development meetings, and to Dr. James Shuba, consultant to the Johns Hopkins School of Medicine and president of SPOHNC, for the very interesting clinical overview of xerostomia. Thank you to the Dudley Digital Works media team, especially John, Kyle, and Eric, for all their help with the technical aspects of this meeting, and to James Valentine, Larry Bauer, and to the other planning committee staff, especially Erica Rauscher and her team at THANC, along with Marianne Caputo at SPOHNC and Elizabeth Lipton at the National Foundation of Swallowing Disorders, who worked so hard to plan this meeting. Thank you to our supporters and partner organizations, but a huge thanks goes to you, the people with xerostomia who shared your experiences, and to those of you who called in or wrote in sharing your insights. We'll compile all the information from today's meeting, including the polling data and all of your comments, into a Voice of the Patient report, which will be available on our websites, along with a recording and transcript of the full meeting. The web link you are on today is where you can continue to submit comments for the report, which will be open for another 30 days, and we encourage you to do so. The video and report, along with the list of supporters and partner organizations, is publicly available to anyone once it's published and posted on our websites. There will also be a link on the FDA website. In the meantime, the live recording from today will be available immediately on this webpage. Thank you again to everyone. The impact of this meeting will be felt for years to come.